Hey guys, can y'all hear me? This was a last minute thing here, so bear with me. I can't find my earbuds. Trying to get everything set up. I wasn't even ready to come in here. Um, okay, so can y'all hear me? First of all, I guess I should ask that, huh? And I know I didn't play the intro. I just popped on. Oh. Hey, Eric, Kathy, can any y'all let me know you hear me, please? Because my computer's doing some crazy stuff too. Love it. Can you hear me? Okay. What's going on? Okay, you can hear me. Thank you. Thank you, somebody. Okay, so I was just thank y'all. I appreciate it. Oh, okay, this was just a real I don't know what you want to call it. Pop up one. You see what I look like? I haven't been to sleep since yesterday. So it's gonna be one of those come as you are. Uh had a rough week, guys. I think and I've missed most of it. I've missed most of it. I I know that it started yesterday, and then things started today in our community, and it hurts, and it's okay to talk about. I mean, we're not dissing anybody. We're here from our mental. Oh, love it. Thank you. Do you know what? I haven't slept since yesterday. Like or whenever I went to work yesterday, I got home today about 1 o'clock. Physical therapy, and then I went out to my tanning pool because it was freaking so pretty outside, and I slept in my tanning pool, I think, for about 2 hours. So, yeah, I was getting ready for bed. I'm in a sweatshirt and a headband. That's why I said, "Please come as you are." Never, please. Thank you, Kathy. Yeah, and Kathy, I appreciate you. Yeah, no, we're not talking about any creators, nothing negative. No, we're not talking about creators. We're talking about us, our own. And I don't have anybody. I'm here all by myself back here, so it just is what it is. Um, but yeah, we're not. And I worked last night. I worked really late. I did actually. I worked. Oh, I was late. Alicia, don't worry about that. I was just late. Like always. Y'all can depend on me dependably late. Something I'm trying no, I don't like that word. Something I am attempting to overcome without my ADHD meds is rough. Um, so okay, thank you, Sarah. And Lemon, Aria, I love it. Alicia, yeah, Kathy, I mean, all of you, thank you. I mean, literally, thank you for being here. I wasn't gonna do this, and I guess the more I thought about it, the more it's if I need a mental health check in, I was wondering, I'm like, how many other people are gonna need it? Because when our community hurts, we hurt with them. And I think there was a reason. Some people may believe in this, some don't. It's okay. But I think there was a reason that my plans for my live today didn't happen. And I really believe that this was why. I'm meant to be right here, right now. And oh, and yeah, me too. Indigo, me too. honestly. I don't know. I always say, I'll ask Alexa. I don't want everything in here to go off, but I'll say, "Is Mercury in retrograde?" And she'll either say, "Yeah." I am too, Lumen. Thank you so much. Um, she'll say, "Yes, Mercury's in retrograde until," and she'll give me the date, or she'll say, "Sorry, you need to blame your problems on something else." I'm like, when does somebody make her such a smart mouth? But um, so we're gonna do this a little different. I don't like being up here by myself. So, and I don't like talking to myself. Yeah, it's been rough. It's like it was a super full moon, a blue moon of this seasonal blue moon. You'll pop in. Okay. I'm dropping the link in the chat. Okay. Rules are we do not talk about any other creators, nothing negative. This is our mental health we're going to talk about. Is that cool with everybody? I just want to make sure that y'all, and even my mods understand it. I mean, I'll boot people out if you know. Yes, this is a seasonal blue moon and Mercury in retrograde. Yes. So I just want everybody to understand. I don't. You could pop in, Marilyn. Thank you. I love you, Mama Bear. Um, I'm gonna put the link in the chat. You can come on, talk with me. We need a mental health check in, and we need a temperature drop. So I thought maybe this would just. I mean, I'm ready for bed, guys. Look, but I thought this might be just what we all need. I know it would be me. Oh, I know you would, Indigo. I was just saying. I was just saying that I just for anybody that wants to, you're more than welcome. I mean, we need to have these discussions about our mental health, especially after this week from hell. So let me get this link in the chat, and Kathy, can you help me? Because this one, wait, I might. Oh, I got it. I did it, y'all. Kathy, y'all have no idea what she does for me. You have no idea. My life would not be my life without her. Okay. I've got room for we'll do 2 at a time if you want. There's the link. I'll put you up on stage. Anybody got a mental health check-in, wanna talk, please, by all means, you're more than welcome. Was that the right one, Kathy? Hey, Mandy. I am so glad to see you. Oh, alright, here we go. Tell me when let me see when you're ready. You ready? Okay. You there?
Hi.
Hey, no. Oh, see, I lost my
I am.
earbuds.
Can you hear me?
I can hear you. Let me turn my volume up because I lost my earbuds between the tanning pool and my house now, and it's like they're sacred. I can't find them, and I was rushing around. That's why I was late. So I hope it don't echo back. And we'll see what happens. 'Cause I'm using
Yeah,
the
I'm here.
other. Okay, is it echoing to anybody? Hey, Indigo, talk and see if yours echoes. We we can you talk? No echo. Okay, because it's just coming out of my side computer, and I didn't want it to echo in the microphone. Heather, I think you're right. Well, Indigo, so how are you? Are you able to hear me? Oh, what did I do?
Let me see here.
Oh, okay, can you hear me? I can hear you now. I had to fix this. Oh, can you hear me, babe? into you? Going in.
I've been having a rough time.
Okay, it's working. It's working. I
Yeah,
can
I
hear
can
you.
hear
Great.
you.
Okay, wonderful, wonderful. Okay, I'm gonna turn this down a little bit now because I didn't want it to echo. Thank you, Mandy. Um, okay, floor is yours because I have been talking to myself forever. I feel like I just talked to myself.
Yeah, I can hear you.
Okay, great. Well, so how have you been? I might need to get closer, y'all. Oh,
Uh,
oh, hey,
um,
Dawn.
I think there's a delay because when I
Do you want to back out and come back in?
dropped. Yeah, I'm gonna try doing that. Let me see if that works.
Okay. Thank you, Anne. Heather, I think you're absolutely right. It would definitely be hypocritical of me. It absolutely would. Mandy. Oh my. Oh my. Oh my. Oh my. Can I have my cheese? That is actually the one thing I eat. Dang, I'm close. I'm on a big screen. That's actually the one thing that I do eat and love it. I'm gonna post this back here. So there we go. Don't you know? Hey, Blake, this is where you need to be then. Because you see this? I'm ready for bed. Okay? They're ready for bed. Simple as that. I am totally 100% ready for bed, but I probably would lay there and yes, wait, I no, I got OSA in and OSA. Yay! OSA in and OSA. I am privileged. Oh, so Liz Gale will be here um Monday at 1 o'clock Central. No, I said that wrong. 1 o'clock Pacific. Somebody do the math. I haven't slept in 2 days. Uh, she's they're coming, they're coming, they're coming. Let's see. Okay, here we go. Let's try this. That better?
Okay, let's try again. Here we go.
I I, I
I
can
think
hear
that's
you.
better. Can you hear me?
I can hear you.
Okay, perfect. I can hear you.
Yep. Yes, it was just a lag. That's okay.
Yeah.
Um, so how have you been?
I've been having a rough time lately. Just like a lot going on in my life, and then my brain just decided that it wanted to remind me of past traumas when I was just living my life. So you know how that goes.
Do I ever?
I tend
Yes,
to like
do I?
laugh when I don't know, I have a dark sense of humor sometimes.
I don't think we would make the only reason, and I'm not being rude, just so everybody knows, I do still have, psychiatric residents I have to take care of, so when the phone when my phone does go off, I'm not ignoring you or being rude, just know that I'm trying to take care of that too. But, so you've had a week like we have. I
Yeah.
have. Yeah.
And I
And dark
journal and I have my therapy, but it's just like everything is happening all at once in three corners over here. And then,
yeah.
I try to chill out and then my brain is just going thousands of miles an hour. And like you were saying, when I pop back in, it's like I could try to go to bed when my brain's like that, but I'll just lie there.
Yeah, and my
You
other
know,
half has to
I
be
won't
up at
actually sleep.
and he has to be up at 3:30, so he would not appreciate if I did that right now.
Oh my gosh, that's an early, early start.
Yes. He walks out of the house at 4:30, so but well, this platform is open for everybody with mental health check-ins. So, what talk to me,
Yeah, and
talk to
I
the chat,
I
whatever you feel
think
like talking about, we're here.
I think the hardest thing is like I always kind of try to distract myself by helping other people so I don't have to focus on how I'm feeling.
You know what I'm fixing to say,
So,
right?
you do that too?
You understand what I'm going to say. You got to take care of yourself before you can take care of anyone else.
Yeah. That
And
that
it's the
is
truth.
so hard. It's hard to
I'm the
like
pot calling the
to
kettle
do.
black.
Yeah. I was going to say, "Are you sure?"
I know. I am the pot calling the kettle black. Yeah, that would be me. I need Marilyn's emojis.
Aw. I'm trying to pull the
Okay.
chat up on my phone so I can see what people are
Okay.
saying.
Yeah, I'm back here by myself, and honestly, I'm just trying to keep up with the chat. Why I'm using that word more?
'Cause
That is one of the worst words in the vocabulary for me that I do not like. I don't want to use it. I don't. I just things are different with each person, and they have their own little deal. Hot meat kettle. Yeah, I don't like the word try. I think I've probably explained that before, but I just don't like it. And I've been using it a lot lately, so what does that tell me? I just say if you're doing something and you fail, it just shows you that you gotta find another way to succeed. I think
yeah,
it's
and I kind of look at, like, if you don't okay, I don't know I don't have an alternative word, I guess, besides try, but, like, to me,
no,
I
no, I
never
mean,
kind of
I've been using it.
but, like, I think for me, it's, um oh, hi.
Heather,
Hi. I'm having a good mental health day, so I want to try and pass some of that on to you guys.
thank you.
Oh, you're so
Thank
sweet.
you. Thank you.
Because I
Heather,
had
you
a
look
bad 5 days and weekend,
mhm,
and um, like I think that's what this show does is counterbalances, right?
mhm.
Miss
Absolutely.
Sunrise Dawn.
What'd she
And
say?
that's why it's so appropriate that even though you kind of run this show, Keela, that you ask for it.
Thank you.
Yeah, and I do think it's nice to have focuses outside of everything because, like, when you're dealing with the scale of Scientology and what it does, or anything that you're actually putting effort into fighting, it can be hard to remember to take a step back because you kind of feel like you're not doing enough. But then I don't know. I just kind of remind myself that I have to put all that energy into myself as well, if that makes sense.
No, you make sense. You make a lot of sense.
So
I
I
think
I'm
that
trying to
can
do
be
that.
hard to get to though too, like to talk to yourself.
Oh, not
Mhm.
me. I have car talk. Hasn't anybody watched my crazy channel?
I have shower talk where I yell at the shower about issues I have with people. And when I lived with my best friend, he would be like, "You had a good shower talk with me today, didn't you?" I'm like, "Oh yeah, I guess I could just talk to you for real, right?" And he's like, "I mean, you could. Yeah, we live together."
Oh my gosh.
I'm kind of like Reese when she talks about like she has to talk through it to be able to get to the
Yes.
other side. And lately I just haven't been able to figure out what I want to talk about or how to even put words from my brain to my mouth.
Okay, so okay, I'll jump in on that one. I, were y'all in here when we were talking about the journaling, like for ADHD? It's it's I don't like to use the words like that's cute. Hang on. Mr. Wise or yeah, our wise young man. That's cute. I literally talk to myself all the time. I tell people I'm crazy first. It saves me the time and breath of having to explain.
Like I've met
Like
you like one time on camera, but I love you so much.
I do too. He knows.
I'll be
So
right
with
back. I have to go change
journaling,
my glasses.
okay. With journaling, okay. So I'm off my ADHD meds, and I literally have tapered myself off of them for the last 3 weeks, and there's such a big difference. I'm having to learn again. You know, don't tell me something and expect me to remember it. It's not going to happen. Don't expect me to be on
Is
time
there a
for anything.
reason that you tapered off of them or
Yes, yes. I've been on for the same medicine for 17 years. It's worked wonders, but I started going into heart failure. What is wrong with mine? Ah,
Oh
hang
no.
on! Don't leave! Don't leave! Don't leave! Hang on!
I'm not leaving. Okay,
What
that
is
makes
going?
sense. So it's like to take care of one medical thing, you had to stop
I
doing
was
the other
yeah.
thing.
Hang on! I messed up now here. What is going? Okay, my
By
We'll
the way,
camera.
I
just
love your
play
orange glasses. They give me life.
musical. Oh,
They
thank
remind
you.
me
The
Uh,
of
home
these purple
was,
ones that I used to
oh my
have, like
god!
that were like
That
these glasses, but purple.
yeah. Well, those are my nighttime glasses because they supposedly cut out the blue light and all the other lights so I
Oh,
can
that
go to
makes
sleep
sense.
better.
Yeah.
I don't know that
Oh,
it works,
sunrise,
but
you're so sweet.
okay. All right. Here's the deal. Seriously, that's never done that.
I joked when I met with my friends in June because something was in retrograde and none of the technology would work in the car. So I said, "I'm sorry, I'm in retrograde. Blame it on me."
Oh my god! Can I please use that?
Yes,
I got to get a shirt made. I s- I
that's
did
good.
say that to
it should be a
myself.
new
My
mental
camera
health
did.
matters merch. Sorry, I'm in retrograde.
Yep.
I love that. Okay, so Anne, this is really cute, but all of it, I really didn't. It all I got a little warning up there that said that
Oh, I guess
said
we
your
do this.
camera has lost connection with your browser. So, and it was just all the lights were off of it. I didn't even touch it. Solar flares. I was fixing to say that, Ann. I was gonna say it's got to be solar flares. Ann said
I
it.
was gonna make a joke, but then I realized, okay, for everyone in the chat, I'm not being ageist, okay? But I was also gonna say you could just blame menopause.
Well, I would, but I have went through that at 23, so
Oh my gosh, really?
yeah, no kids.
Oof.
Yeah. But okay, so
I
before
got
my
I
camera
I
decided to
got through
root,
that.
but now I still have the hot flashes because they took, I had no hormones, so yeah, I was a little, but um, I started finding ways to different things to do, and some of the natural stuff worked wonders. And now and then I got off, I tapered off that, and I was gonna take it. But they were scared of me taking anything. So I have one kidney and liver that's pretty much shot because all my seizure meds and everything go through it. But it does repair itself. So,
Mhm.
we just give it a little time, and it'll 50 years. I made it this long. But with my ADHD medicine, I did get off of that because I'm on so many anticonvulsants, and my heart rate for some reason was staying resting 166.
Oh,
And I'm a paramedic, so I can tell you right now, I'd have been putting the pacing pads on somebody.
not good. Yeah.
So, and then my blood pressure was just so high, and so now I'm on all the heart meds and blood and pressors and not just Lasix furosemide. Now I'm on furosemide, which is stronger than Lasix. So my poor kidney, I got to watch out for it and make sure I drink enough water. But my legs are literally like at the end of the day, this you can't see my ankles. So we are trying
I
to work through.
relate.
But then my labs came back, and I have hypothyroidism. Didn't know that. So started Synthroid, and I'm
Hyper or
like, I've got
hypo?
enough hypo. I think I'm on Synthroid. So,
Yeah, I'm on I was
mm,
hypo, and for 6 years, I went to my doctor being like, "Hi, I have a problem with my throat." And my old doctor ignored me, and then when I got a new doctor, they're like, "Well, yeah, because you have cancer." And so in 2023, I got a surgery for that, and then they said after the surgery that I would go from hyper to hypo because basically, like, all of my hormones your thyroid, by the way, everyone with a thyroid, that
mhm.
controls your hormones,
Yes,
and nobody prepared me that I would go through premenopause, when they didn't have the right medication dose. So they
that's
said, "Oh,
it.
don't worry, you don't have to do chemo, you won't lose your hair," and I'm like, "Well, joke's on you, I got hot flashes, night sweats, my hair thinned, it, like, fell out in the
Mhm.
shower in bunches," and I was like, "What the heck? You guys did not mentally prepare me for hormonal imbalance."
Oh, and it's a real thing.
Yeah.
Bless
I
my
think I
roommate,
think that
he's just like, "You're not crazy. We'll turn the fan on. Here's a cold compress." Meanwhile, I'm, like, yelling at him because 'cause I'm losing my mind. I'm like, "I'm going crazy."
no, okay, so what I think for, like, a lot of us with premenopause pause or just menopause, um, I have a great saying I like to say, "Hell hath no fury like a woman scorned, so stay away."
So
Stay
don't
away.
scorn me, right?
Hell hath no fury, but I'm having a hot flash.
Yeah.
Yeah.
I know, my other
That's
half,
funny.
he drove up today, and it was, like, probably 103 outside, and me and my roommate were out there in the
Too
tanning
hot.
pools, and I fell asleep. I was out. Like, that's the most sleep I've had today was, like, an hour and a half, but I had already burned on my front, so I turned and was laying on my stomach. I put some cool water back in it, and I was out. I don't He drove the truck up right next to us. I never heard it. I mean, I guess I probably could have just been drowned or kidnapped because I never heard it. I was so tired. But it felt so
I've been
good out
there.
there. I don't like being cold, and I don't know if that's part of thyroid or not. Couldn't tell you. But I don't like the
So,
cold.
when you're hyperthyroid, um so I didn't get above 135 pounds until my 30s. Because with hyper, it's like burning your calories, it's like running you on high, right? And so you're
Right.
skinny and you're always cold, and I hated winter because I was like, just I could never get warm.
I
And
stay
then
cold.
like the first summer, like the summer after my surgery, I actually got heat stroke because I wasn't used to being overheated. Like I went from being cold all the time to
Mhm.
suddenly being too warm. And my roommate came home at the time and he was like, "You're not cold. Take off your sweater. You're too warm. You need to like cool down. Like you're getting
Yeah.
heat stroke." And I was like, "Oh, I had no idea."
Yeah. Yes. And you don't
Yeah,
sweat
so
when you get to that point.
mm-mm.
But that's because nobody talked to you about it, right? So you felt like you didn't have the rest of the information.
I did a lot of research on my own because all my issues started with like nodules on my thyroid, which if you've like which if they were actually inflamed, I could go into the doctor. You could see it like under your skin on your throat
My
right
sister
here.
had
Right.
a goiter. Is that what it's called?
The
A
goiter.
a a goiter that they
I'm
took
not
Hmm.
off.
sure.
They took off her
Hmm.
thyroid. She has
Those,
Hashimoto's.
yeah, but I think what she's saying,
They're like
like
sacs that
right
fill with
here.
liquid.
Oh, okay.
Yeah,
Yeah.
because they're covered by my t-shirt right now,
Right
but I
there.
do have scars
Oh,
from my
okay.
surgery. But like, so the nodules would fill with liquid. It would hurt my throat because obviously there's a bump in there that shouldn't be there.
Mhm.
And then one time I got I got sick somehow and it swelled so badly, like I couldn't swallow water. And so I called my dad and I was like, you have to drive me to the ER because I'm too broke for an ambulance. And so he drove, honestly, so he drove me
If
there and
you
they're
only
like,
knew.
what
Mhm.
seems to be the problem? And I just pointed, like at that point, I couldn't even talk to the nurse at the intake desk. I just was like in a wheelchair pointing at my throat,
Hey.
like right
Welcome,
here.
Marie. Hey, Power. I'm sorry. I was telling them that we have somebody new for the first time in the
Oh,
chat.
Mary
oh,
Marie Rasicot?
Yeah, here, let me put up welcome to the chat. Welcome to Mental Health Matters. We're having a chill day. This is like a mental health check-in, relaxation.
Yeah.
You can come on, people come on. I mean, I get tired talking to myself.
impromptu. Come get what you need.
Yes,
Yeah.
absolutely.
Um and
And hey,
and
Power, how are you?
and I will say too, I'm just gonna
Mary?
say Marie because I don't want to butcher your last name, but it was more that my dad was in the medical field, and so when I started having chronic problems in my 20s, my dad was like, "Oh, we should look into this. Like, we should look into this. We know these conditions run in the family from your mom's side." And so I actually had to do all my own research. Like I had to look up everything that I ended up finding out because doctors wouldn't listen to me
That seems
Mm.
to be the norm.
because I have ovaries.
Mhm.
I
I mean,
went
I'm
in
not dogging anybody. I'm just stating
because
facts.
when
I'm a
I was
paramedic,
having
work with them.
problems, like I was going in saying my aunt had hypothyroidism. One of my aunts had hyperthyroid. I think there's something wrong with my thyroid. And they were just like, you're too young, you're too hormonal, blah, blah, blah. And I was like, no.
Oh, guess what? Guess what?
Yeah.
Hi, Gretchen.
You wanna pop on, Gretch? I'll drop it right there. We're just having a mental health check-in. I think everybody needed it today.
Yeah, sounds like
I've
it.
just been dropping in the chat if you wanna say hi. It's up to you.
That's why it's like taxing sometimes because when you have so many chronic things, and I had multiple things wrong at the same time. I have like a list I'm going down of like 5 or 6 things that I needed to go to the doctor for. And the first one was my throat because you got to eat and drink. Um, and throat issues were getting in the way of that. So, and people are like, well, how did you have the energy to keep going back? I'm like, I wanted to survive. I
Right.
didn't have a choice. It was like,
Yeah.
if I can't eat or drink, I have 7 days I could live, tops.
Right.
Like, if you look at the average amount of days you
No,
could.
yeah, I mean, yeah, you're absolutely correct.
So I was like, it was literally like, if I don't look into this, I could die, and so I looked into it, but I think that that's the thing is, like, the medical field needs to change and stop looking at how old you are when things happen and just start noting that things happen at different ages for different people. Because I told them, like, my friend was like, you could have gone and sued your old doctor 2 years after he ignored you and you ended up with cancer. And I'm like, with what money
Right.
and energy? I spent 6 years getting someone to listen to me about one problem. What money do I have to pay a lawyer to go fight for me in court for what, like
Okay. So here's my advice. Then it's just advice. The strongest advocate we have is ourselves.
Mhm.
You have a right to say no. You have a right to get treatment. You have a right to get partial treatment. This is and everything in between. That is your right as a human being on what you allow or don't allow with your body. And if one thing my mother, she's a registered nurse, she's always told me, and then when I started working with the doctors in the ERs, I was like, oh great, now I see why my mom, would say that about come home saying they got a God complex. Sorry, Dr. Gretchen. I got you a link there to come in though. um, but she was right about that. Like they don't give you 2 minutes. My mom always said, doctors, doctors, save patients, but nurses save doctors because they, I
True.
mean, they just don't pay attention, and there's so many people and so few in there, and I work in the mental health field, and I can play devil's advocate on either side. But what I would tell you is you are your own best advocate. And we have seen in such an increase. And this is not to get into any of this topic. I'm just making a statement. But since 2020, there's such an increase in these weird symptoms and all these symptoms. And they thought I was crazy because I kept saying, I kept coming up that I
Mhm.
had an autoimmune. I had long COVID. Yes, I've had COVID 6 times. And I had long COVID after the first time that I got it. And it was horrible. Nobody believed this back then. Nobody thought it was a real thing. It was all psychosomatic. Oh, that's just a female. Yeah, I know exactly how you feel. I
Yeah.
mean, and I was driving 2 hours to a different town to where I had a doctor that actually believed me. And now they're trying to take her her physician's license away for treating COVID patients. So,
Yeah.
and she's saved
Wow, that's
5,000 people's
crazy.
lives. And now the Texas board's trying to medical board's trying to take her license away.
Yeah,
Dr.
and
Bowden.
yeah, and it's crazy too because that's why, the Supreme Court thing with um abortion or when people try to come after birth control, I'm like, what people have to understand is yes, medications. This is a great example. Ozempic is not a weight loss drug for superstars. It was originally created as a tool for people with diabetes
Mhm.
to try to lose weight healthy, you know, because of all the issues that diabetes causes. However, obviously it can be used for other weight loss or like birth control
It's
is not
intended
just
to
used to prevent you from having
Right.
kids, it
right.
balances your hormones.
Your hormones, yeah.
So it's like
You have
in
your
those
desired effect and your intended effect.
exactly, and like in those
Mm.
6 years, they kept just treating symptom after symptom. I was at one point on 13 medications. Like,
Uh,
I couldn't keep my days straight. I couldn't like, I could only work and sleep, basically. And then I thought, like, "You know what? I gotta" you're right, like, I had to advocate for myself. And it's not
yeah,
just women either. I had a friend say, like, "I'm really stressed out because my boyfriend who was a little overweight" oh, yeah. If you're a little overweight and have another medical issue, they just tell you just to lose the weight.
Right.
And it turned out that her boyfriend had colon cancer. And
right.
they just told him to lose weight for 3 years, and they could have caught it earlier, and it would have been a lot less bad. So it happens all across the medical industry.
Yeah, in the last 4 years, it's gone because people didn't get out to go to the doctor. I mean, especially the first two, 2020 and 2021, there was a lot of people that weren't seen by doctors that should have been because everybody
And
was locked in.
also, anybody with a uterus, respecting
Oh, Aria, I'm sorry.
them,
That and
them
yours was
they
recent too.
Oh, yeah, Ari just got
that
home.
you
Go ahead,
know
Heather, I'm
that
sorry.
you're told that. And I think the other thing I always kind of bring up too is that, all of our medication that we take, whether um, male, female, has been tested on males, never on women. So they don't know how women are going to react. Now, some doctors and scientists have gotten better and are trying to do some studies, but they say because we have hormones, we're not good candidates.
Well, I
And yet
don't
we're
have hormones, so
taking
how about that?
the medication.
And see, that's the thing is like not every person on this planet is a white dude.
Right.
And that's
I
basically
agree
the
with that.
pool that they take for medications. And like it's frustrating because like I know that I have privilege being white, but I know that I don't have privilege being a woman. Because if I
Y'all,
was a
I didn't
white,
savage
like a
myself. I didn't
Yep.
savage myself. I'm still here. It's my camera
but you
just
know
went
what I
off
mean? So
again.
like if we were um there's also conditions that I don't understand why they just assume that anything medical is gender based. Cancer
Right.
affects men and women regardless of
Hmm.
what type it is.
Hmm.
Fibromyalgia, if you're a man with fibromyalgia, it's 4 times harder to get diagnosed because they consider it a woman's disease, which I don't know how they come up with these mental pathways, but then they say, "Oh, well, why don't you just go to your doctor for answers?" I'm like, "I tried for 6 years, dude." And then I I will tell you the difference it made. I have 2 male doctors right now, my psychiatrist and my endocrinologist. Everyone's a woman and no one is like Caucasian, if
Hmm.
that makes sense. Like a
Hey,
lot of my
Right.
doctors are not or American, I should say, like, you know what I mean? They're not like a 70-year-old white American dude.
I'm
Right.
back.
And that made all the difference. And I don't know if it's
Hmm.
because people come from maybe like other countries and they have more perspective and they want to treat the actual issue and not just the symptom. So yeah, I love my new medical staff.
That's
They're
great,
I
great.
think
though.
they've got
That's
new
great.
training too,
Hey,
you
Yeah.
know.
Cricket.
So, hi,
Great.
Hi,
Gretchen,
Gretchen.
with your beautiful
Hey,
hair.
ladies, can
I
you hear
know.
me?
It's so beautiful. Yeah, we can hear
Yes.
you.
Yes.
We're all
I'm
tired
in the
too.
car. Oh my gosh. I've been going since this morning. And so but thanks. I'll come on for a little bit. But I'm obviously in the car waiting for something else. So I can hang out for a little bit. But this is
Your
a
hair
topic
is
really,
pretty.
thank
I knew
you.
this was your topic. Your topic. This is yours.
I
This is
know. And I could not talk about it. It's gosh, there's just so many stories, both professionally and personally that I have, but it's the intersection. I was just gonna share one thing is because I have Hashimoto's hypothyroidism, so I can relate to you, Indigo Twin. It's like, and when I first got diagnosed and I was trying to figure out what it meant, and then I went to an endocrinologist, and he's like, "Well, you don't need thyroid medication quite yet because your labs are fine." And I said, "Okay, that's great," and I feel like crap, kind of thing. And like, so what about
Mhm.
that? It's like he didn't
Right.
even kind of identify the Hashimoto's part. He just was like he was just treating the hypothyroidism, and it took a lot for me as a mental health professional, believe it or not, to say, yeah, I'm having depression symptoms, I'm having anxiety symptoms, and this particular endocrinologist said, oh well, you're a therapist, so you know how to deal with it, and kind of
oh
dismissed
my
me
gosh.
about that. And I
Oh,
thought, oh my goodness, like it takes so
What?
much for any of us to even say that we're having some struggles with that, let alone, to write it down or to bring it up. And then, so that was kind of, that was like a dismissal of two kinds in the same appointment, like a dismissal of symptoms, like kind of brushing them off, and then
Yeah.
a dismissive of mental health issues related to
right.
all of it. So
Right. Well, so
And
what do
I
you
still
think
haven't
that
even.
doctor would have done?
Oh, I'm sorry, Heather.
If they actually decided that, oh, well, you need some mental health help and you
Oop.
weren't a practitioner, do you think you would have gotten?
maybe, my hope is, I've run into a few locally here, some, doctors, let's say in higher positions that actually like directors of units and stuff that are actually very mental health focused, which I really appreciate. I would hope, Heather, that, they would say, okay, like, you should maybe think about seeing a therapist. Heaven forbid they have like some referrals or some kind of
Right.
information. I mean, and I'm not trying to dog down on doctors, but it just, I think we've all had the experiences of just um, getting dismissed or getting kind of pushed aside. And that's frustrating. And speaking to Keela's point, it's like, if you're not already an advocate, it kind of forces you to be one, and admit it, there are some
Yeah.
appointments where I will bring my husband in and knowing that they're going to kind of listen more intently sometimes just because he's there.
My
And
dad, who's
likewise,
80,
yeah, go ahead.
is my medical contact.
Mm-hmm.
My sister's 8 years older than me, and I'm adopted. So in case anyone's like, "You're 34 and your dad is 80," it ain't mathin'. There you go. There's the
The
math.
math ain't mathin'.
The math ain't mathin'. But like, my dad worked as a medical physicist, so the guy that goes in and tests all the machines that scan people to make sure radiation is at the right level and whatnot.
Oh,
And he is really educated, and so I was like, "You have to come with me. No one's listening to me." Um, I've tried coming in with facts, with family history, just with he came in and immediately was like, "Blah, blah, blah, medical term, blah, 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 medical term." And the doctors
Mm-hmm.
were immediately like, "Blah, blah, blah, answer." And I'm
and,
sitting here like, I'm
I
the
said, "Talk to me like I'm
patient.
2. Explain
I
it
was
to me
like,
like I'm 2."
um,
That's
and thank God I got the most amazing woman who ended up doing my surgery. She goes, "My goal here is that I never see you again. I want to get the scans. I want to do this surgery once. I want to get you like so this doesn't come back, and I'll explain anything you have any questions on." And I was like, "Can
Mm-hmm.
everyone be like you, please?" Because it made me realize, like, I was scared about that was my first big surgery that I remember. I could have had ones when I was really little. I was premature, so I don't know. But she was like, it was refreshing to be treated like an adult in a situation because I feel like a lot of times if your medical contact is still your parent, even though you're an adult, there's still like a weird perception doctors have of you. So it was
yes.
really nice having one explain everything to me. She even drew me a picture. She's like, "You need a picture of what the thyroid looks like in your neck. Here's a picture. Here's how the surgery is going to work. Here's what I'm going to do." And I was like, "Thank God for her." I was like,
You
"Can
know,
I leave a 10-star review? Like, my
talking
chart
about
won't let me review you. Could I leave you like a 10-star review and a gift card?"
talking about, your parents being your emergency contact, your power of attorney, medical power of attorney, whatever you have, advanced directive. I know that it doesn't matter what I have and what I have on paper. When I went into my surgery in January, I mean, I'm a paramedic. I've done, you know, hundreds, especially during school and during, internship and clinicals. I mean, like hundreds of intubations in surgeries and watch surgeries. And I'm going to tell y'all, I was a little concerned, or no, I was a lot concerned. Hey, Shelly Kelly, I did not want my neck cut on. I was scared to death. I was terrified. I'm like, not of the scar, of I know what's in there. You know what I mean? You
Mm-hmm.
got a jugular there. I mean, I know the anatomy, and I was freaking out. And so I went home and watched the video, and I'm like, that's it. They use power tools, lots of them. I mean, I don't know how they get the drill and the hammer and it all goes in that one little slit there. But
Mm-hmm.
it was
Yeah.
so simple. They just pulled this, pulled this. They had me stretched down on the operating table, and he literally just one cut, and then there's one little muscle inside. That's the only thing he had to cut. He was into my C spine in less than 5 minutes. Of course, it took him way longer than that to put me to sleep because evidently red hands are harder to put to sleep.
I think I had a spike of adrenaline before my surgery because like they I was still awake when we got to the OR. Like it
I
didn't
was awake.
I wasn't
Me too. And in
they
the
were like
OR,
they were
they made
wheeling
me.
me in and I was like, "It's cold. Can I get a warm blanket?" And they're like, Why
Well,
are
they
you
didn't give me
awake?"
my first ed though until like we were almost in the OR. I'm like,
And
shouldn't
you
I
know
have
what the
gotten that
thing
way back
was?
there?
I mean, I believe in I believe in prayer and vibes and
Yeah,
whatever
absolutely.
people do that their thoughts are there for you. Because my dad actually told me afterwards, he was like, they told us it was supposed to be like maybe 4 hours for the surgery, and there was some kind of complication. Because like the whoever helps the surgeon like sends text updates like we started the surgery or
That's how they did my mom. She was out there with
whatever.
me.
And my dad said like what ended up happening was they thought originally there was only one cancer cell on my thyroid, but when they went in to take it out because I had those nodules, it caused like scar tissue.
Mhm.
And they tried to do the surgery, and obviously I can still project my voice. There's some people who get this surgery and something goes wrong and they basically sound like ASMR
Right.
unless they get like cuz your vocal cords are basically like
Oh yeah,
underneath
they're
underneath
right
your
there.
thyroid.
They're
They're
right
just
there.
right
Yeah.
there. So but my dad said they like texted that there was some kind of complication, and then, of course he's freaking out cuz he's like complication.
And
I didn't know.
well,
I was out. I was out on the OR table, so what did I
I
know
was in
about
there for 8 hours.
complications?
Six
But
hours surgery, 10 hours recovery for this surgery, and they had to give me Narcan to wake me up. 10 hours in
Oh,
recovery. So I
Oh
can't
my
take pain
gosh.
medication. They gave me Dilaudid, and they put me to sleep with propofol. But I'm allergic to like fentanyl and all the other opioids. So I don't know why. But they gave me 0.1 milligram. 0.1, not one, zero in my IV after surgery. Of course, I don't remember any of it. And my mom said 10 hours later, she was really concerned. And she doesn't tell anybody she's a nurse when she goes in with me anywhere.
I
She
like
Right.
wants,
that.
yeah, she will not tell them,
Mm-hmm.
and she wants to hear
No.
what they have to say. That's where I learned
Right.
that
the
from about
crazy
being
thing
my own
was
advocate,
like,
because she
Mm-hmm.
would teach me as a young child. That's not right. That's with her, and she would show me in books. This isn't right. This is what they told you, or what they were trying to tell mommy. That wasn't right. It wasn't correct. They were wrong, and here's why. And so she just always has made us be our own advocate. Once, oh, absolutely, Cricket, absolutely. I've seen her do some good
yeah,
ones. My mom has done some good ones, but she told the nurses in Houston, she was like, "Okay, my kid's been in here for 10 hours," and they just look at me like they look at my age, and she's like, "I don't care how old she's my kid. Okay, she's my kid."
yeah,
And she's been in surgery for like 6 hours, and now it's going on 10 hours, and she's still not awake. Wake her up. And so
Yeah.
they had to give me a bunch of Narcan to,
Wow.
to wake me
so
up.
redheads are hard to put to sleep, but they're hard to wake up too.
Well, see, I'm just sensitive. I'm allergic to all pain medication. I've made it through this whole
Yeah,
neck surgery with just ibuprofen, 800 milligrams, Flexeril, and um, hang on,
and that was the thing too because with
Xanax.
all
Oh, and
the
my Xanax I take for anxiety. It would like calm me down.
yeah, with my knowledge of other people in my family's addiction issues, I was worried about like getting opioid painkillers just because like I haven't struggled with addiction, but I was like, I don't want to start after after a surgery. But
Right.
luckily, I had a really nice black nurse taking care of me overnight. And about the third time, they woke me up for my vitals, which I was like, you literally came here 5 minutes ago. I don't think my vitals changed in 5 minutes. And she's like, honey, I brought you the good pain meds. And I was like, okay, thanks. But I was so tired. I was so tired, and I had to sleep sitting up for, like, 4 days because, like, you don't wanna choke on stuff in your throat and whatnot. And I just
I
remember
want
my mom had like braided my hair. She's like, I'm just going to braid your hair before you go into surgery. And I was like,
I
okay,
had to wear a big
thank
purple
God.
cap. They put mine on my big purple cap, but it was so cool. It had these big purple. I've never. This is new stuff since I've not been working in the hospital. It, the go in and get this purple gown on. They hook a hose up to it with warm air going through it. I'm going, what in the heck is this? I had no clue. Literally, no clue. It was so cool.
I'd like to see a picture of you in that purple cap
Oh, I
and
got it.
that
Oh, I
big
got it.
like whatever you're describing, the big like outfit with like
Oh, it was
is
amazing.
it probably looked like some kind of crazy Halloween costume.
I could not believe that I didn't even. I looked up. I saw the hose run into the bed, and I was at Methodist in Houston, and I saw, I saw the hose run. I'm like, okay, this might be pre-op, but what have I walked into? Hey, yeah, my interview here still hasn't let me interview her. Yeah, there's some in my bag right
That's
there.
a cute dress.
Yes, this is my roommate.
It's shorts.
What? So
Yeah.
cute.
She's
my
going to
gosh.
be coming on. Her family is in a cult, and she's going to be coming on telling her story.
Oh, good.
That's why she's been my
awesome.
roommate for 6.5 years. So, but so let me find out. That was fun because it was. You put this. It's. I don't forgot what they called it. It's. Hey Keith, I see you. Thank you. What
Hi,
kind of
Keith.
I can't remember what it was called. It has a name too, but it's purple gown and you put it on and then they hook the hose up to you right here and it's warm air that just blows all in it. I was like, oh, this is cool. But I got on the operating table, same thing I got on there. I remember every bit of it. They didn't get that guy did not give me Versed quick enough. I knew that already. But they're so that's what they are. Wait, they got it right there. That's it. That's it. Hey, Diane.
Uh,
That's it right there. That's what they're called. Yeah, I had never had one until I had surgery. But
I never heard of that at all. I
oh, it
don't
is
think
amazing.
I had
Like,
that for mine. Well, but you said you had a spine surgery
yeah, I
or
have
a plate or
all my
something?
discs in my neck they collapsed. Well, I'm a paramedic. I know C5 keeps you alive. Well, it crushed my nerves, my nerve roots. It tore my spinal cord in 3 places.
Oh,
Ouch.
They had to laser it shut. So I literally went to see the neurosurgeon for the first time on the day after Christmas, and I was in surgery January 8th. That's how
I'm
quick I
glad
was
they
there.
could I'm glad they could do it that quick. Yeah, like my whole thing
Yeah.
is when I go into crisis like like with my health or if someone else in my life kind of like has a health crisis, I just immediately shut off the emotion and go factual. And so for
mm,
me, like I got diagnosed November 27th, 2022, and I had my surgery February 16th, 2023.
Oh
Yeah,
wow.
because this year is 2024. And so like
right.
I just didn't have any time to like think about the diagnosis. And like I would just tell my friends, like when I got the diagnosis call from my doctor, I was like in the middle of my normal job work day. And um
Oh,
Can y'all
and
see
I'm
that?
jealous. I didn't get a cool like
Hang on.
suit thing for my
can
surgery.
can you
Is
get
it
those in different like temps? Because right now I'm going through some major like heat flash, like hot flash. I would like some cool air in mine, not warm.
cooler? Oh, it
Yeah.
was
Flashes,
so
oh,
cool. I
they
mean, that
suck.
purple thing, I'm telling you, that purple thing was like the coolest thing I've ever. I was like, how did you put
Oh,
this on? It was so neat.
wow.
Can we just
Yeah.
like get a hose to suck out all my sweat at night so I don't get night sweats anymore because they're freaking
okay.
gross.
Yeah,
That's the
Yeah.
thing I
was
had
this
after my
for
surgery
8 weeks.
that they did not
So
prepare me for.
that's
I
Keely, you
literally
wear it.
woke up one day just like
oh,
drenched and I was like, oh, gross. Yeah, but I didn't have any time to like, so they were like, hey, you have cancer. And I was like,
hey, Power, be nice
oh,
to Keith.
okay. let me just tell my parents and my closest friends at the time. And my friends were like,
It was
oh
not
shit. And I'm just sitting there like, yeah, it's whatever. We're gonna get through it. And they're like, girl,
no under my
backtrack. You are not having an emotional reaction to this at all. And like now, a year later, when they're like doing the follow-up scans, now I have time to process emotions. Because like it was,
Survival mode.
yeah.
Yeah.
What did I miss?
November, December, January, February. It was like now all the emotions are kind of coming up like a lot later. Yeah.
Mhm.
Yeah. So it's like
It's a
a
good kind of
lot.
like a coping, right? I mean, it's a way of kind of
Yeah, right?
compartmentalizing it and
Maybe
just
we should all buy
focusing your
those
brain.
suits for ourselves that we could use them at home.
Cricket was saying this.
Yeah.
I had to go back
Well,
up and
because,
look.
I mean, we're all going to be doing a weird Amazon search later. Amazon's
This
going to be
host
like,
comes in
are
a
you
wall, y'all.
okay?
I'm telling you, it's in the wall like an oxygen. I was like, what are they going to do with this to me? I'm going in for
Oh
back
gosh,
surgery.
I can see Kayla totally freaking out.
And I was like 122 pounds the day that I had surgery. I stepped right
Oh
there
man.
in pre-op. I'm like, I'll swallow in this thing.
Now,
And
I'm gonna have, I don't know if it's a dream or a nightmare. I'm gonna have dreams about you in a purple outfit.
it was so weird. And then they started raising up. But
I think we should Keela, give that to Kathy and we gotta put that picture on a thumbnail for one of the
There you
lives.
go. Yeah,
Oh man.
you
oh,
totally
I'll
have
send
to
it to
use
her.
that.
Oh,
Yeah.
We should all just
Oh,
buy like really baggy purple jumpsuits and take videos with a fan blowing it and post it on our community page, but don't explain it. Be
Aw.
like, if you were there, if you know, you know.
if you know,
You
you know.
know,
right.
if you know, let it blow.
See, yeah,
And then I'll wear like I'd like to get like a snuggie. You know, remember those, they were like really popular.
Hey,
So,
I have a pink
Right.
snuggie.
and I'd like to get one, but I'd be way too hot.
I stay cold.
You
all
should
the
get like we should get like a purple baggy jumpsuits and then put snuggies over and be like, who needs snuggies when you
Cricket,
have
yes.
this? Just
Move
Cricket,
them on and
yes.
off.
Right.
If anyone has some kind of big, oh gosh, no
Dude,
context grimace suit photos.
Oh my gosh.
who's gonna grimace when you can have this
A
too?
mental health booster. Oh man, I'm
Oh
gonna
my god, it's
next
really sending me now.
if
I
I
don't know why.
I'm gonna look on Amazon after this and see if I can
oh my
find some.
gosh.
I know, right?
Yep.
And that's why I said we're all gonna have really weird Amazon searches. Amazon's gonna be like,
We have to
these
come up
10
with
people,
these.
what the heck?
I mean, I guess you could get the same effect by putting like a little tabletop fan underneath. That'd be a blow.
There you go. All you need is a tie back suit.
A what?
When is
Tie
that?
back.
Oh,
Tie
You know the
back.
white suits that you wear
oh, no.
for
Oh yeah.
if you go in to
Okay,
clean things
careful.
up.
Oh,
Yeah.
Yeah.
that's right.
Yes.
Tons of
I
real.
think of them like hazmat. Are you talking about like
Wait,
the
Yeah, like that.
yeah,
Yeah, they're
protective,
made
yeah.
out of tie
Okay.
back, so I
be
call them.
careful.
Yeah.
She had a new grandbaby. She's going to see her new grandbaby. Mhm. So her daughter had her grandchild the week 1 week apart of our grandson. Yeah.
Oh wow, that's a good timing.
What was really cute was they were both standing at the island in the kitchen, and we were sitting there eating, and I said, "Oh yeah, Daryl, did I tell you Angela's going to
Hazmat
be a
bunny
grandmother?"
suits.
And she said, "Oh yeah, Daryl, did I?" And he goes, "Oh yeah, Angela, did I tell you I'm going to be a grandfather?" They were a week apart,
Wow.
and we had a boy, or Kayla had a boy, and
Oh my
Angela's daughter
god,
had a
Chow,
girl.
sumo
So we got
suits.
both.
Get out of here.
So.
I mean, don't. That was a joke.
Oh wait, child, yes, cricket. Wait, there we go.
I'm just reading the chat.
Oh my gosh. We need to do a Halloween
Oh,
episode,
those would
totally.
work.
Oh, we have to. Oh man,
Those would
Kelly, I
But
wonder
yeah,
if
totally
Kelly
yeah.
would
work.
come do werewolves.
But
at
again,
this
no
episode.
explanation. Just like I'll show
No
up wearing the same
explanation.
thing, and people will
Just
be like, "What
People are
the?"
I
gonna be
guess
like,
no, it would
take a
be
picture.
better if it wasn't Halloween because people assume it's for Halloween.
right?
Like some kind of like
Right.
group
That's true.
costume. So we need to do it on a random day.
Yeah.
Okay.
People are
Yeah.
gonna be like, mental health matters, and they might need to matter.
They might need to check their mental health. They're
Oh, I
wearing
got
these
told that
crazy
today. Don't
suits.
worry, I got told that today too.
That's
These
funny.
But
Oh my
purple
god.
suits.
no, I got. Let's
Oh
see,
my
how did my
gosh.
day go to or go? No, yesterday evening before I went to work, Wednesday. I didn't. Hey, Don, you coming on? You coming on? Here's Don. All
Hi.
right.
Hi.
Hi.
Oh, this
It's
is
nice to
cute.
meet
Look
you.
at that. Runs to Amazon wish list. Yes, right.
Hey.
Can you imagine Amazon just flooded out with all this?
Uh, I can't see the chat. I,
Miss Sunrise Dawn, are you in on the purple costume?
Sure.
Is that a kitty? A little
Oh,
baby?
Who's
Yeah,
this?
this is.
Hope.
Aw.
That is Hope.
Hi. I'm
We
sorry,
got.
that's
The
my
kitty cat.
baby
This
animal
is
voice that I
Oreo.
use on all animals. Oreo? Oh,
Um,
perfect.
Where's Hope?
I, I might have to go out and come back in for some reason. I don't know if y'all hear it or not, but I'm hearing an echo. Like I'm hearing
I'm wondering
the
if mine's
conversation and then I'm hearing it.
Keela had to do that
Do you
too.
have the
So
tab open for like I had to close the window that I had on YouTube because it creates an
There we
echo
go.
if you're like in YouTube and StreamYard at the same time if you're not the
okay.
host.
I
I
think that
think my
maybe that
problem
worked.
is I've got the speakers coming out of that computer because this is just a monitor, a big monitor. It's why I always wear my earbuds so it don't hit the microphone. But I don't know
I
where they're
can't
at.
see.
And I can't
I
sleep
can't
without
see
them or I'm
chat
gonna
though.
have to go to be incarcerated because
Only bad.
I can't do snoring.
The sad thing is I can't see chat. Oh well.
You
I
do
just
here,
thought
let's see, Child Blake. I think they got the chat. They're good right now. You good?
y'all just looked
And
like you were
here,
having so much fun. I wanted to come up there with you.
We are having fun.
That's right. Oh my gosh. We start talking about
oh
blower
wait,
like gowns or outfits. I don't know.
look.
What they didn't say I can.
Group
I don't have
versus
my reading
anyone.
Okay,
glasses.
pool our resources.
$600 to
Oh my
1,500.
god,
Am I
Holy
hearing that
that's
crap!
right?
crazy.
Wow. I think the
Oh
snuggy idea
power!
with a fan is better.
Oh gosh, if Blake just takes the power, yep. What? Why don't you come in here and have some chats with the women?
Yeah,
Wait.
come here.
Blake and Power, y'all, come on.
I guess Oreo wasn't a fan of being on the camera. He left me.
Mm,
Oreo didn't
That's
like
all
the
right.
topic.
We
yeah,
got a
No,
exactly, that's what
cameo.
I'm thinking.
We got a
Yeah.
but
cameo.
we got another one though.
Oh, okay.
Oh, the
Aw.
There's
soft
Callie.
babies.
There's Callie.
So pretty.
It's
yeah.
impossible to have a stream with me on it without the cats. So we have 14.
Oh my god, I was dying laughing because we had a kind of an important team meeting last week because one of our people got let go. So they did like a team meeting and like 4 people who had cats, their cat jumped on the desk and turned their butthole to the screen right when we got the news that our coworker wasn't on our team anymore. And I just about died. I was like, oh my god.
That's perfect.
And it
Oh,
was and
timing.
when they do those types of meetings, they have to record them.
Oh my.
So I was like, you just got 4 beautiful cat butts
Oh my gosh, that's
forever
great.
on screen. Like it was
Yes,
great.
Judge.
You
It's
couldn't have
really
planned
all
that
right.
better,
We are
actually.
definitely.
Yeah.
This is
Well,
much needed right here after I mean,
yes.
this truly is a real
Cat buttholes and big
Yeah.
purple bear huggers.
Anybody on the
Bear
replay gonna be
huggers
like,
and
"What in the
cat
hell were
ass.
they taking?"
Well, and I'm pretty sure everybody here watches the live boat. I tell Tommy all
Yes,
the time, this is Squirrel's twin.
Yes,
Oh
definitely.
it
yeah.
is. Oh my
Yeah.
God, squirrel, cat in a basket.
hmm
Oh, Heather, did you see Yachty? Hang on, I'll pull it up.
What's that say?
Oh, Yadira,
Heather
Heather
Mack
Mack
is
is
what?
so
Hang, I
cute.
can't see it. Oh,
She says you're
Yadira.
cute, girl.
Aw, Yadira.
Oh wait, Ann's got
Love
it.
that.
Look, Ann,
Tax-free
here you go.
medical needs. Yes.
Power. We fixed it.
I think
want
Get
Anne is onto
Frito.
something there.
Yeah, I want.
Okay, we
Yeah,
could.
Power. Hang on.
Okay,
We
crazy
gotta talk
idea.
about
We
this.
could like ask the community, be like, give us trust that you're donating to an important thing, and tune in for the update, and we just come on with the suits on.
Oh my
He
gosh.
fixed this, and we're
And
talking about
like, don't
this
say
thing.
anything. Yeah.
Mm-hmm.
And just like start with Keela and Gretchen and then have us in the background and they just like keep bringing us on in purple
Actually,
blowing
I'm
suits.
gonna make this. I think we should do some kind of
That's funny. For our expat.
like a not a competition, but like who can design the best bear with
Oh
the
my
things they
God.
have around their
I did
house.
mine. No, I
Oh
didn't.
my
You
gosh,
put
that
Oh,
would
it
be
away in
okay.
the.
So you
funny.
can't
Oh my
buy
God.
anything.
Oh man, I can go to the
Ooh.
hospital and get one.
Hmm.
No, we gotta
We're getting
design it. That'll be better. Yeah.
we're getting a
Okay.
lot of mileage out of Keela's surgery experience.
Yeah, sorry,
Yeah,
Keela.
yeah.
I don't think
Yeah,
she
but when it
minds,
comes
right,
to
Keela?
medical supplies, I've already got them. I can look.
Ooh,
We could get such
inflatable purple suits that are $30.
$30.
I love
Oh,
how
okay.
Chow got our
Where's that
back. She's
at?
like, we could do this, we
Can
could
you
do
put that
this,
on
She's
we
there?
could
on
do
it.
this. She's
I know,
on
like she's
it.
really on it.
Look in that hand. I'm sorry.
Winner,
See if
winner,
you can
chicken
get a
chat.
discount for multiple orders.
So
That's
I wanted to
true.
say, I know we're all laughing and everything, but he's got a very good point. Paralyzed, paralyzed. Ladies, you know you never ends are going to take down the Scientoverse. Thank you. He's not the first
Hell
one who
to
said
the did you know, according to Aaron Short, ever since we protested the opening of Chicago
Thank you.
org, there has not been a single new person recruited by their org since they
Really?
opened.
I heard
Yeah,
that
I didn't
too.
Yeah,
How
I
do we
don't
know that to be
know.
true?
I
That's
don't
awesome,
know,
but
well, because
okay.
I've been watching Aaron since before Reese, and I
Right.
Yeah.
think that he's got some kind of trust with people who are undercover. So I'm not going
Absolutely.
to ask for sources,
Oh,
but
okay, got it.
yeah,
Got
so
it.
like
No,
that's my
he definitely
assumption.
has. Yeah.
I got it. Yeah.
But
That's
that's
true. I never thought
amazing.
about he could have them from all over
Yeah, I
in
mean, look
different
where Reese was.
orgs. Yeah.
Wasn't
So
that how he
y'all,
originally? Isn't that how he originally found Reese? She was
you
under
call
the
it
Yeah.
the
radar.
aftermath.
Yeah, it was. Because she contacted him and they talked for months
Hmm.
Yeah.
before he
So,
doxed her.
y'all, I'm telling y'all, they are recording every single bit because he wasn't up there, but I mean, I didn't even see it. And I was watching it like a tenth of a second. It was crazy.
Yeah.
I told him right
Well,
then
I
it
and there.
just
I
doesn't
want to
said,
take
know,
much
so
to.
the day that Corin brought her hilarious suits, I
mhm.
Yeah.
actually got there like 2 hours early, and I went in just like as a person do. And I wrote down, because I'm like, I'm not going to use my real name. But I still want to know if they actually called, because I wrote the phone number and address for the FBI Chicago office. And I want to know
Oh,
if they
what?
actually called them. Yeah. I was like, I'm not giving them my real name and address.
Nah.
Oh man, that was good. That was so good.
So I'll have to see. I'm kind of curious if they actually called the number.
Would y'all like to meet Oreo's look-alike?
Who would?
Aww.
Oh,
Oh,
This
Is
is
that Oreo
Skylar.
too? Is that double stuffed?
This is Skylar.
Oh, he's so cute. Oh, look, he loves
He's
you.
looking at you like, I know you're talking about
Yeah,
me.
I get on
yeah.
there with her in the morning time, and then they don't leave her alone. She cannot get on her computer at all without.
Mm.
They love
Well,
you so.
she wants to be loved on, but not held much.
Yes, Ann, absolutely.
So,
Hey,
That's
Kate.
she's like, you can pet me, just not snuggle me.
but I did want to show y'all the one I always tell Tommy every time Tommy comes on there. She's running over there, seeing who's on the screen. I think she just, well, I don't know if she likes his voice or not, but that's Shelly.
Oh my
oh,
Oh,
goodness. So
I
she
like
oh,
her
looks
look
little.
at
soft.
your little nose.
She's
Oh
the
no,
softest of the bunch.
I believe it.
And
that's
this
adorable. That
one is
All right,
that's the
Cricket.
second softest.
there.
You have to get on here
And
and start teaching language classes. I know Mercy was it Berku? Boku? Thank you, Cricket. Thank you. She sent the link for the purple suit. I'm definitely getting it.
Yes. Okay, I'll get that.
There we
$30
go.
is not bad at
Yeah,
all.
let me see up
I
here.
can't
It'll
see
be my
y'all
first video.
into the chat.
That'll be a
Ladies,
good
I gotta head out now or run. But I'll see you tomorrow, Keela.
Okay, yes.
Yes?
And we're gonna do my therapy is over. Hey, everybody, wait.
We're gonna discuss
Oh, I'm
anxiety tomorrow,
sorry.
right?
Yes, we are. Yes, we are. And it's a good time. That's why I needed to come on here.
Yeah.
Everybody was having like just a rough time. I'm like, you know what? We're
Yep.
gonna come on here and let everybody just have a chat.
We're gonna talk about some. Yeah.
Mental health check in.
It's
All
been a
right. Well,
rather
nice seeing
crappy
you
day
all.
here too.
Thanks.
Thanks,
Thanks for the
Greg.
Bye,
laughs.
Bye,
Gretchen.
I'll see you
Gretchen.
Bye.
tomorrow.
Have a good
Okay.
one.
Take
Bye.
care. Good night.
Good night.
Oh,
It,
she's such a
it hasn't
feeling.
been a very fun day here either. Started out with my kiddo didn't want to get ready for school. Then I had a little fender bender in my van. After
Oh
that, I was
no.
like, I'm going back to bed.
Yeah, just
You
keep
know
Uh,
what?
piling it
Oh,
on.
right here.
I could not get out of bed this morning for work. I like waited till the last minute. I was just like, why do I have to get up today?
Wow.
I haven't been able to work for quite a while with my because of my vision, but even when I do, I'm a writer, so I work from home. So I'm kind of lazy.
Cricket, will you email me that?
Yeah, that's the balance. I work from home 3 days a week and I go into the office 2 days a week.
That's what I do too.
So
Since mine ends up being like Wednesday night, and Thursday, and I end up looking delirious like this.
but like if you get I did so in college and I can't do all-nighters anymore because of this, but I did an all-nighter for a paper and then my friends were like, let's do a movie marathon. And I was like, okay, 48 hours. And then like after 72, I was like, this is ridiculous. I need
Yeah,
to sleep. And
How are you still functioning?
I crash
healthy thing.
after 5 days.
Wow.
I can't stay up like past 1 in the
Okay,
morning
so
anymore.
thanks so much, Cricket. I'm gonna tell you one thing. I don't care what anybody says. I did it, so I know it's the truth because I did it. I stayed up 11 and a half days, and I was cramming for finals, like cramming. And I don't ever do that, but something happened. I think my what is it my seizure, loss of memory, is kind of self preservation because I all I just know is I was living on Red Bulls and like I wasn't even eating. I was just like
Oh,
Red Bull, and just sitting. I was literally just trying to. And when you're already on ADHD medicine, you're like, oh God, I quit taking it. I quit taking care of myself those whole 12 days. It was right before Thanksgiving break. I stayed up literally 11 and a half days. And the last thing I remember was
Girl, how?
I wasn't driving. Red Bull, I'm telling you, I drank so many Red Bulls that I don't know how my stomach didn't have a hole in it. And the ADHD. I do better at night. I work. I mean, I can concentrate better at night. I speak better at night. I can get more things accomplished at night. And there is a study that shows ADHD people get more accomplished at night or in the
You know
evening.
what? I've noticed that with my friend's fiance, he definitely is more awake and active at night, and he's
I am
got
too.
definitely got ADHD. So
Well, see, Blake, but caffeine doesn't do that to me. When you have ADHD, caffeine doesn't.
Caffeine
I
can,
actually, yeah, it knocks me out. I'll go to
yeah, it
sleep
can
and
same
do
I'll
the
be
Blake.
out.
opposite.
I actually fun fact that's not really fun, but like the reason I had to quit caffeine was because the doctors were like, hey, after this surgery, the medication we're putting you on, you can't have too much caffeine because it will make your heart rate spike.
Yeah, because it's stimulant, but that's not what it
Mhm.
does.
But did I listen to the doctor? No. And we were moving a
Yeah.
table from our apartment to the dumpster, and I about nearly passed out down the
What are you gonna
stairs
do?
and scared the shit out of my boyfriend at the time. Oops, sorry. And then
Oh, you're
he was
fine.
like, "You need to," and then a neighbor of ours is like, "You need to sit and drink some water." And then my doctor was like, "How much caffeine did you have? I told you to cut back." And I was
Remind
like,
me of Beavis and Butthead.
"Yeah, no," but then I was like, "No, you're right." And so, yeah, that journey was tough cutting it back.
It it really is a tough journey because like he gets mad and wants me to go. I understand, I don't want to go to bed every night by myself. Come watch your iPad. I don't want to have to, put a pillow over somebody and because they're snoring so loud. But
And see,
anyway,
I'm a morning person. I'm definitely like
I
that
get
is
up
one
with him
person.
early but I sleep with my earbuds on and my iPad going every single night that
Oh,
I'm in.
see, I wonder if that's an aid like being able to sleep when you're listening to something is also an
It's
ADHD thing because I can't. I have to have it quiet. If there's
Mine
like
is if I hear somebody snore again, it's called premeditation. I can't handle it.
See, I'm like Keela, but I don't have ADHD, but I am a nighttime person and I have tinnitus. And it's
same
gotten worse since I
with my
take this one
ears.
medication.
But
And yeah, I have to have music or noises going.
but do you know that so my mom and I were discussing this sleep thing because so my doctor
Cal,
just
you should order it.
put me
Sorry,
on
they're still talking about the
Belsomra.
soup.
Has anybody heard of that before?
Heard of what?
Belsomra.
I've heard of
Mm-mm.
it.
It's a sleep medication.
Hmm.
No, I
Oh,
haven't heard
yeah.
of it.
Okay.
Okay, well, because I haven't been my Apple Watch sends a report to her phone, my doctor's phone or email, I'm sorry. Um, and because I have not been sleeping enough to even dream, so she said not enough REM to dream in months. I said that's me. I mean, I just don't sleep. I mean, I can lay there. You can go make me lay down like a 2-year old. I'll go lay down in my bed like a little girl. And I'm gonna lay there and I'm gonna watch TV. Or I'm gonna watch my iPad or I can't. I do not just go to sleep. So, um, I said, now if I put my earbuds in, I'm not hearing snoring, and I go lay down. I can go to sleep, but I don't stay asleep. Well, you're gonna take this. We're gonna try this. I tried one. I know better than to try anything without seeing what kind of side effects. She just told me if this, or this. It's a freaking hypnotic. You could drive a car and not even know it.
Yeah.
It literally says you can cook a meal and clean your kitchen and whatever, and you'll never know that you did it. I'm like, I ain't taking that ever no more.
That sounds like disassociating with a medication, and I've done that without a medication, and it was scary.
Yeah, I'm not taking this stuff.
That's what it sounds like when I left my bad ex the first year I lived alone and was working.
Hmm.
I didn't I found some people talking about DID and I'm like, "Oh, that's really weird. I get the disassociation thing."
Hmm.
And I realized that what would happen was I would just like disassociate during work and then I would be home. Meaning for like a half hour, I did not remember driving home,
Mhm.
but I always drive the same exact route every single time. And lucky for me, the 3 or 4 times I was disassociated, I got home. But that
Wow.
scares me looking back. I'm like, what if I don't know, what if I drove somewhere else? What if I didn't take the same route every time? Like, that sounds terrifying to have that as a result of a medication.
Yeah.
No, so I got rid of my car. I sold my Hyundai Santa Fe because, like, you could put the and I'm sorry, I don't know all these terms. What is it? The enhanced cruise control. So it'll slow down when you can set it for 2, 3, or 4 car lengths, and if it sees a car slowing down, it's gonna slow down, and whatever it does till it's clear, then it speeds back up to your cruise setting, whatever you
Hmm.
had it on, and it'll do it every time. And it drove itself. I didn't even have to touch the steering wheel once I got it in. I mean, except to turn roads with my blinkers, but I mean, on one road, I didn't have to touch my steering wheel, and I was getting to the point that the long way home, I mean, the short way home, that one road, if I don't turn on my road, which is like the next to the last one before you hit it, it tees into the main road. There's railroad tracks right over there. It don't stop at stop signs. So no, I was scared to death I was going to end up across the railroad tracks because I wasn't getting off work until like 2 or 3 in the morning. And I'm like, yeah, it's time to get something else. I miss this car driving itself and staying in its own lane, but or moving lanes if it needs to. But I I just got babied to that and used to it. Now I have to
Yeah.
actually pay attention.
Hey, y'all, I think I'm gonna have to go ahead and jump off here. I think my 5-year-old's trying to wake up, so I'm going there and help
Uh-oh,
her
she's got
make sure she
school,
can
huh?
go back to
Okay.
sleep. Yeah,
Good
she got
luck.
school in the morning.
Well,
Bye,
thank
y'all.
you.
I'll be in the
Thank
chat.
It was good to meet
Bye.
you.
Good to see you.
Good meeting y'all. Bye.
bye.
I don't know
Thank
if I can figure
you.
out how to leave.
Oh, you want me to pull you
There we
down or
go. I
can
got it.
you
I
got it?
got it.
Okay.
Red X.
Oh yeah, I need to post this back in here and see who else wants it. Oh, I was way up
Okay.
there. I was looking up for something from actually from Cricket. I'm just
Sorry, the
Oh,
posting it.
chat's cracking me up. Oh
I
my
know
god,
they
Anne,
are.
did you get her the suit? Is that what's happening now?
I'm
Cool.
checking my Gmail real quick. Hang on. Let's see.
I will never take a pill that makes me clean anything, Yadira.
I know Yadi wrote that. I was like dying over here laughing. Where is it at?
I
I
watched
had
this
an experience with one of
Oh,
channel.
those
there it is.
drugs.
Oh, the one of the ones that where you don't remember doing stuff.
Oh, what
Well,
Cricket? I'm fixing to order this now.
actually, it kind of like really zombied me out. So I wasn't waking up, but the way I was breathing, my boyfriend came out and he watched me and like came over and stood over me because he thought I wasn't breathing. He thought I died
Oh
on the
no, your
couch. I
poor
don't mean to
boyfriend.
laugh, but yeah. And he was like, "What did you take?" And I said, "Well, the new medication, and they want me to, go up from there." And he was like, "Yeah, no, you're
Oh
not.
my gosh, that's
You're
perfect.
not taking that anymore." No. Oh my gosh.
Look,
Oh, I love the green one.
Should we
I
all
know.
do
Look
different
at
colors
this.
or should we all do purple?
We have to
Cricket,
do the
you're on
purple,
to something here.
Oh my
Green's
gosh.
well, we
mental
have to do the
health.
purple because that's
I like the
the
purple. I
The
like the
green is
that's too
very
purple.
funny.
bright.
Yeah, it's like the mental health. Like is that like
There
neon
you go. Yep.
Neon, yeah.
uh, or
But
lime
that's
or
scary too. Like the thing about um my new team is that they're very cause oriented.
mm-hmm.
And because I actually my new primary doctor, she said two things to me the first time she walked into the office and I met her. She said, "I'm sending you to an endocrinologist for your thyroid," before I even said anything. And two, "What can I do for you?"
Wow.
And I was like,
Ah,
"What?" And she's like, "You're paying me. What can I do for you?" And I said, I want to find the cause, not treat the symptom. And ever since then, it's been like, what referral do you need? Like she'll be straight up about the knowledge that she has. Since she's a primary, obviously she doesn't have deep knowledge about like specialties, but she'll be like, it sounds like this. I'm going to refer you to go to an appointment with this specific specialist. And it's kind of refreshing. And she's like, yeah, if a doctor isn't doing what you want, and unfortunately it's not that easy with insurances and stuff, but like it got me thinking like, yeah, why did I stay with the same doctor so long? Was I just afraid to find a new what I was afraid of was going to multiple doctors with the same symptoms and then being told I was like seeking
Mm,
or like
That's
doctor
I can't
switching
stand
or
that.
whatever
I'm
they
sorry. I
say.
can't handle it.
right.
I can't handle that when somebody does that. Oh, there's you know what? You know when I'm sorry,
I can't
they're
read
like, "What
Chow's
did I
chat.
just
I
walk
gotta look.
into?" Well, first you
Oh
gotta read the
no.
first one.
Okay.
Hang on.
Search for
Yeah.
experiences. What
Is it
did I just walk into?
Oh yeah, I can't think of a better name. It's a long story. Just go
Purple
with it.
suits and
yeah,
medications
with
that
it.
knock you out.
Yeah.
Were the guys or any of the guys gonna come up here and talk? Come on, y'all.
Is
Are they
Blakey
still
still
in
here?
here?
Did he go?
I don't know if they I don't know. Power, Blake, are y'all both in here or not? Did that go up? No? What happened? There. Where is I don't guess they are. Well, we've got 19 people.
Well, it's been an hour and a half, so
Yeah, I got already? How come
yeah,
when
Yeah,
you're having
girl.
fun, it flies
yeah.
like that?
It
Well,
does.
check-in time, Keela. How do you feel?
Yeah.
How do you
I
feel?
feel a lot better right now than I have this entire week. Thank you, all of you.
I'm so glad. Laughter helps.
I need to.
Just laughing.
Yeah. Well, self-care
Cricket,
comes
come
in
on.
like so many different things that you can do.
I
I
just
went outside today and it was really nice out. Just like
Good.
going outside on the porch was nice.
Yeah.
I had to have sun therapy. I mean, I even asked my doctor, I'm like, why are you putting me on vitamin D when I'm in the sun like literally every chance I can get out there? Yeah, come on, Cricket. I dropped it in there.
It's because they want your levels at a certain point. Like I was okay, my vitamin D levels were
Blakey,
under 10 before they put me on
come
vitamin
on,
D
Cricket.
treatments. And then that made a huge
Hey, what's up?
Hey!
Waiting on
Wait, hold
Cricket
on, hold
now.
on.
It was only a cameo. No, just kidding.
Can you hear me?
Yes.
Let's see.
I'm actually having
So
trouble hearing
if
you.
I do this, I'm poking Blake, and that's as close as I can get to him.
Oh wait. Am I mirrored? What are my hugs?
There you go.
There we go.
Chow
There we go.
Yun.
Hey, Cricket.
Hey,
Blakey!
What's up, Cricket? How you doing?
I look like fresh
how's it?
death, but you know what? That's okay.
That's
Girl,
what I
you're
said.
How's the
Look, I
in
was getting ready
law?
to go to bed,
yeah.
and it was time for mental health check-in after this week.
Y'all look beautiful. But I wanted to ask,
Oh,
is there any
Blake.
way to turn up the volume for all of you?
You're beautiful.
Let's
Oh,
see.
thank you.
Don't know much
I'm having
about
trouble hearing y'all.
StreamYard.
Are you?
I think it's
Do you have
StreamYard.
the stream open anywhere else that you're on the
Yeah,
same
you.
device that you're doing the call? Sometimes that messes with the echoing.
Mm-mm.
Yeah,
I gotta
because I
change
hear
my.
an echo now.
Can I try to come back in?
Sure. Yeah, just
Sure.
hop
Okay,
out. Come
I'll
back
be
in.
back.
Okay.
How are you, Chow? It's been a while.
Yeah, I'm still upright. You know, I'm doing the thing,
That's
living my life.
good. It's good to
Yeah.
see ya.
How is it? Everybody else now, y'all asked me. Mental health check-in for y'all.
Who wants to go first?
Well, I already came in saying my day was like pretty good. I wasn't
Us?
having anything too bad, but I planned for it. I had to be up really early and help a friend get her to some appointments. And I knew not to schedule anything else so I could come home and sleep. I didn't, but um,
Sharon.
it's like the rest of the day is just rest. It doesn't matter what I do, and drink plenty of water.
That is great. I laid in
Water
the
is your
water and
friend.
got like totally drenched in it all for like 2 hours. I got to sleep today. All right.
Water.
Yes, water. Yeah,
Yeah, I know. It's made me think.
Can you
Blake,
hear
is
us
that
now,
better?
Blakey? You're muted, honey.
You're muted. Is that better?
Can you hear us
Blake,
now? What about now? Maybe
he's
now?
muted.
Can you hear me
You
now?
muted yourself.
Are you going to savage yourself like I did?
Oh, now we can't hear him.
Now we can't hear you.
He looks very sweet though,
He
even though
said
we can't
one
hear him.
second. Look at that
Standing
little
by.
smile on him. I know.
He always looks sweet. He's the best.
He really is. He
He's
really is.
Yeah.
down there saying like testing, testing. Hey, Sharon. She's like testing,
He's
testing,
been helping me.
or testing, testing. I can't even see.
Testes, testes.
There you go. Because I'm like literally, my glasses are blurred. It's been a long day, long night,
He
long
is
day.
wise for a
Oh,
young
let me.
man.
Oh,
That's what I call him,
he
wise
has
young man.
so much wisdom.
Chow, you crack me up.
That's my job.
Hello? Hello?
Oh,
There he is.
yay!
We can hear
Hi,
Blake.
you now.
Bruce.
Can you hear us now?
Yes, yeah, I can. I don't know why it was doing that. That was weird.
Awesome.
Retrograde. Sorry, one of us is in
Mercury's in
retrograde. Sorry
retrograde.
about that.
Mercury's in Gatorade.
Mercury got
Oh,
COVID.
God, this is funny. This is so freaking
Sarah
funny.
Browett,
Wait.
hello.
Look.
I can't see on my phone.
You know what? This would be a good group for us. Yeah.
Oh, Lord.
Oh,
Just
my.
kidding.
The very
You'll
idea
never know
of
what
all
you'll
of us in a
pull.
seance.
Oh. I was gonna say you never know what you'll pull in with a seance, and then I was like, oh, pulling it into
Ooh.
Scientology term gross.
Yeah.
Do
No,
you
you're
ever
gonna
find
get
myself
possessed.
doing that too? I'll say things. I'm like, wait a minute. I'm gonna have to turn that. I'm gonna have to figure out another. I'll go around the whole sentence to
Term.
keep from using
Oh
that
my
phrase.
gosh. My very sweet
Yeah.
friend was like, "So what did you do with your summer?" And I was like, "Besides deep dive Scientology?" And she was like, "Oh, what have you learned?" And I'm like, "Get this book, this book, this book, this book, and these YouTube channels." Because I'm like, "Girl,
Also,
you're
if
gonna
anybody
need
tries
like,
to tell you the way to happiness, run.
oh
There
my
you go.
gosh."
I tell every single person that asks me about it, if you're in Florida and they give you a pamphlet, run. Just run away.
Yep.
I don't care if you look crazy, just run.
Mm-hmm.
Yeah.
I wish that I could like physically remove the people from that building, but then I would be accused of kidnapping.
Yep.
But they're
Um,
not. How powers
No.
on there said the what?
Oh, there's Power.
Yeah.
Did you finally get my email address, Power?
I'll send it to him if he didn't.
YouTube is weird about letting people put things in chats that even smell like it might be a link.
I know you can't put a link. Like I can't. Do you want me? I don't want to post it all over the God's
It
green
might
acres.
be
You can. Everybody knows what it is. It's
Oh, okay.
super easy. It's just wait,
Okay.
where do I go? There we go. I'm
Yeah, you
back.
got it. Can you get it? Oh, okay.
Chaoyunswat@gmail.com.
Yeah.
It's that easy.
that's a really good selling point. The way that you phrase that, you're like, I was like, sold.
Oh, Dawn's quicker than me,
Oh, nice. Thank you, Miss Sunrise Dawn.
and that's why my mods are amazing.
Yes,
And
they
yes,
are.
Marie, the way to happiness is out the org door. Faux show.
Mm.
Yeah.
Yeah, wait, I forgot. See, Caesar brain. I gotta write that down. I'm doing that on this shirt. What was I supposed to do though? That's how quick it's gone, and it was
Hmm.
funny.
I have to apologize for being boring, y'all. I am so tired.
I'm
You're
exhausted.
not boring at
You're not
all,
boring. I'm
Oh,
Like,
exhausted.
sir.
join the club, man. Everybody's
aw.
exhausted tonight.
Come on, what
Yeah.
did she say
It's just
that I
like when
wanted to
you
put on a
have to spend
shirt?
all your like energy doing like your job and then you get off and then you're like, "Oh, what do I do now?"
Yeah. I get home and I lay in bed. I'm just like, just on.
Well, you were saying like we were joking in another chat where you're like, yeah, if you get the secret to making your brain shut up, let me
Oh
know.
God,
Oh
Because
yeah.
like I'll be
that person
ready
would
to go
get.
to
It's in
bed.
the
I'll
chat.
be
Put the
so
chat.
tired, and in the back of my brain, there's just an a-hole making lists loudly, being like, "Did you
Yeah.
do this, this, and this? Did you think about this and this? Did you think about where you're going to be in 12 years?" And I'm like,
Mm,
"No, but right now I'm in bed."
yep. I
I don't care.
whoever comes up with
Doesn't
that, you can
matter.
have all
I
my
want you
money.
to think about this.
It's like,
Or it
you know,
goes
that my
over
brain's
your
like,
day.
I told
it's
my
because I'm a
doctor,
planner.
I told my doctor many years ago that I have a troop of howler monkeys that live in my head,
Mm.
and they like to have what if parties.
Yep.
Mm-hmm.
So we'll run through a scenario and they'll go, "Oh, but what if?" And then we'll start right back to the beginning and change one little tiny thing and see how it changes. Okay, but let's do that again. That was fun. What if? And they'll do that, and worst case scenario my ass all night long.
And from inside, they're like, "Look, he's stressing out. We're doing so good at this. Let's keep him awake for another 3 hours,
Yeah,
That's what
mission
feeds them.
accomplished.
and
Yeah.
let's give him
Yeah.
nightmares."
Oh,
I'm looking for that post.
I've got it
see,
there.
like I have such a dark sense of humor because I've been through stuff, and I
Hmm.
feel like I also have a dry sense of humor. So in the chats, I always put joking at the end because I know I'm joking.
Yeah.
And I'm very fond of people in a very short time, but I haven't met everybody on camera, you know? And so I'll say something in my head where I'm like, in person, where you could see my face and hear my voice say it, you would know I'm teasing you.
Hmm.
But
Right.
when you're typing it and then the voice in the back of my head goes, well, if you're going to have such a problem, then just don't say it at all. Then you don't have to be worried about what people think about you if you just shut up. And then
See,
I'm like,
Thank
oh,
God for
Gina.
emojis.
and I've always understood dark humor. I've always held space for it. Um, so I mean, I can appreciate and understand when it's happening and why it's happening. It's part of a healing process. It's a coping mechanism, and it's a way of making really hard shit relatable. And
Yeah.
I don't know if it's positive or negative, but I've always been one for it. I don't know if I've ever advocated for it, but I just let people do
Thank you,
what
Marie.
they
I'm
need to
going to
do.
use that now in my daily life. I'll just remind myself that a dry sense of humor is a sign of superior intelligence.
Yes.
There you go. It's true.
But internally, I won't like externally say that to people because that would be rude.
They don't know you well enough yet.
Now, I'm actually, what was, this is when, okay, so this is kind of when I lose it, okay? When it wasn't that long ago that we were laughing our butts off, and I said, I want to use that. We're talking about putting it on a shirt, and now I can't find it. And I don't
Oh,
remember.
it was I'm sorry I'm in retrograde. Because we were
That's it.
talking about
Yes.
what do you
Thank you.
blame
Yeah.
things on if you need to blame it?
Uh,
I'm like, I was it we were going to a spiritual convention and nothing in my friend's car was working. Like as soon as I got in, like her GPS on her phone wouldn't work. My
Mhm.
friend couldn't get his phone to work. And I'm like, sorry guys, I'm in retrograde.
Thank you. I knew it was that.
I
I have to
apologize
write.
for the
That's how.
things I
That's how.
said when
But
I
that
was
would
in
work for
retrograde.
anybody.
Yeah, I'm telling
But
you.
I
I know
get
how
that
Tori
too.
feels about that. It's gone after that.
Or
Now
like
it won't be.
recently, more people in the community have been talking about getting brain fog. Like Cheryl will be like, "Oh, I had brain fog today. I can't like
Yes.
remember." And I'm like, "I get that." And
I had it
people are
from long
like, "Just
COVID.
use your phone calendar. Just use a planner." And I'm like,
Yeah.
"I do." And I still forget. And I will still look at the planner or the phone calendar. I will see on
Don't
Saturday,
compute.
I have 3 things planned. And inevitably will be like, yeah, sure, I'm free Saturday at 7. And then my friend will be like, no, you're not. We're hanging out Saturday at 7.
Oh no.
Yeah. I get brain fog so bad because being a pricer, I have to be all over everywhere in the store that I work at. So that's bouncing back and forth and playing the circle game, trying to remember what aisles I'm supposed to go to. Not only that, but just this morning, I was walking up
I like that for you.
to clock in and I left my freaking car still on. Like, I was like, what? Y'all, this is ridiculous.
It is the symptom of COVID, but it's one of the main symptoms of long COVID.
It's also a
Yeah,
symptom of
pain.
pain, chronic pain,
Yeah.
fibro. You get
Fibros, yeah.
fibro brain.
This is
Uh-huh.
why I'm thinking I have fibro because I have a lot of symptoms. And the frustrating thing is, I've been told I have to check every box before they'll even like diagnose me. And I'm like, give me the boxes and I will tell you if they are checked.
Mm.
So do you, Blake, have anything that like makes you think why you have the brain fog? I mean, it's kind of personal if you want to talk about like
Probably being in a
physical
constant state
symptoms or
of
meds.
stress.
Oh, okay.
Anxiety. Come
That'll
watch my
do it.
interview tomorrow. Hmm.
Yeah,
That'll do it.
anxiety and stress and guilt, I think. I harbor a
Mm,
lot of guilt.
hmm
And part
I
of that,
told you what that is.
yeah, you're right.
It's a
You're
useless
right.
emotion.
Is it
Guilt
is it
is a useless
actually
emotion. I
Mhm.
mean,
I'm sorry, I was about to ask something really
oh, go
personal, and
ahead,
I'm gonna
Cricket.
no, I'm gonna reel it back because I don't want to blindside anybody with an ultra personal question.
But was it for me or
Yeah.
you
Blake's
can't
an open
you
book.
can't go ahead.
Is it actually your guilt?
Come on.
I would say yes and no. It fluctuates and it flips.
Okay.
But I want to say when I like from the age of 18 to now, when I was more trying to establish myself and making my own decisions and stuff like that, I think a lot of the personal guilt
Yes,
comes
Sharon.
from that.
Okay.
Um, but I also think it's just being different from everyone in my family. I think a lot of it has to do with that. So I think
Sure.
there's a lot of give and take when it comes to that side of things.
Well, being different from the rest of your family doesn't necessarily mean that you're the bad one for it,
Hmm.
Right.
you
Yeah.
know? I mean,
Yeah.
I'm different from and everyone in my family are all individuals and we are all very different from each other. Um, but I don't think that necessarily needs to issue a load of guilt along with it.
Yeah, and I really don't think either. But a lot of it, I think the reason it affects me so much is because
Oh, they gotta make that big.
I'm very in tune with my feelings, if that
Mm-hmm.
makes sense.
Mm-hmm.
Mm-hmm.
And even though I'm an overthinker, a lot of that brain traffic gets in the way of logic. You know,
Yeah.
logically, you should be able to recognize when you're being rational versus irrational.
Mm.
And I've worked on that a lot, but it's still very difficult.
It's difficult, I think, for everybody, but usually that's when you go to a friend and say, "Hey, listen, can you give me a reality check?"
Yeah.
Blah.
Yeah.
Let me
Were
barf all
you
this stuff out.
hearing
Let
from?
me know.
Okay, I'm so stupid. This is the first time it's ever let me do it like this. I usually have to do it over there.
Kayla, don't you talk about my friend like that.
I'm,
Yeah, we don't
I must,
like the S word.
I know. I must have done something. What did I do? Because how did I get it to go where I had to go over there to scroll up and down, and now it's here, and I don't know how to get it bigger here. I'm t-
Oh, and
you
Keila,
know,
and
Blake, I
all of
was
you, I
going to
wanted to
ask you.
thank you for letting me come on.
The struggle
oh,
is real.
the struggle's been real today. I just want to get the Blake. You can come on anytime. I told you that.
I love
So,
y'all.
Blake, I wanted to ask you, were you hearing from family members that you were the odd duck, shall we say?
No,
Right there.
just receiving a lot of criticism.
Oh, I
Cause
knocked y'all off. Oops.
oh,
Sorry. Covered you up.
Okay.
I just
I
received
just
a lot of
covered you up.
criticism growing up. Uh,
Now I can't
because
say that.
I'm on the spectrum. I've always been told that, and I kind of believe it. I don't know. So that's
Mhm.
not like an official diagnosis, but I mean,
Okay.
there.
A
I know
lot of
at
people aren't
times,
officially diagnosed, so.
and a lot of that criticism um, was aimed at self and situational awareness. So over time, you kind of put the pieces together and you recognize you're just different. Like there
Right.
are two toy boxes, and you kind of are the one that's left out, you know. But there's a positive to that. There's other people that are interested in that. They don't necessarily want to have to pick from a toy box or a box of shapes and have to decide, well, these are all basically the same, and you know, if I there's this one staying out, it's always left out. You know,
Hmm.
it kind of there's more of a gravitation to that
Right.
because being
Yeah.
a toy, I
Yeah,
Blake,
to
try
be the
can you read
odd
that?
toy.
I try to be that for other people. I really do.
I can't read.
Well,
And
Anybody,
Cassius, thank you so
I'm
much.
blind right now.
oh, it says, Blake,
I
you
love
are
you.
a
That's so sweet.
goddamn magical unicorn, and don't you ever forget it. Why be a nag when you can be Blake?
Oh,
Oh,
you
thank you
need
so
that shirt.
much.
That is so
Absolute
good.
facts.
That's
From
cute.
Anne
Facts.
Casillas.
Facts.
I never
Zero
know what to
lies
say to
detected.
y'all.
And I'm gonna
Words
say
always
too,
fail
like,
me.
See, you've always
this is
been a
gonna be
stuffed
a pot
unicorn,
kettle
Blake.
moment, from me to you, Blake. Um,
Oh,
the
I like this
issue with
too.
overly critical people is not your problem.
Yeah, that's true.
Like they have something inside them that's hurt or misplaced, and instead of trying to look inside and be better, they take it out on other people. So it's not, but I mean, obviously over time of hearing the same message, like kind of how people say you could hear a lie 20 times and then you start
You know,
believing
it's
it because you hear it so often.
Right.
Yeah, that and a lot of it, I believe, does come from a place of love. Sometimes it's the fear of the unknown, like the fear of how outside forces will perceive those differences or approach them or handle them. And sometimes I feel like it comes from the desire to control that because they don't have those same views. They don't get the same effect from just being them. You know, they see that something works for someone else and they want it to work for them and it doesn't. They want to control it to a measure
Yeah.
of, well, this works for me, and I just want that to be reflected in the people I love. Because I still want them to be, I still want that connection. I don't know
Yeah.
if I explained that well.
No,
This is
you
my
explained it
Yeah, you
perfectly.
12
did.
o'clock.
Yeah, you
And
did.
the weird thing about it is they say that
Sarah.
the second gens, the ex-Scientologists, whatever, they're like, and I know for a fact because I sat around the table with Laura and Liz and E and like had
So jelly.
yeah, and just had the most hey Red
Hey, Red. That's so
had
true, Sarah. Thank
I
you.
had
Hey, Red.
the most Red, have you been laughing? If you were driving and listening to us earlier, you good thing you're still okay. But we had the
Sarah
most
said
amazing
permission.
huh,
Oh, sorry.
oh, I'm sorry, what'd you say?
Sarah Browett,
I
Oh,
was saying
her
Sarah
comment.
Browett said permission not to be what people want, who people want, the way people want. Just be authentic and lean into self-kindness.
you're so correct. You're always full of wisdom too, ma'am.
Yes,
And
she is. She's my
called
Yeah,
spirit.
me
she
and keeps
is.
on me every day. Yes.
And her
But
voice is so soothing. Like,
when she would leave me voice messages because it would our
yeah, me
times are
too.
opposite, and when I would wake
It
up
is. She's
I would wake up and I would get to my phone and hers would literally be the first voice I heard every morning. I was
I
so
wish I had that
excited.
voice in my head. The
I
such
know.
a pretty
Australian
voice.
motivational speaker.
Yes.
If we
Red,
could
you're not
upload voice fonts
Well, I
to our
just have to
brains,
Right.
say,
that would be that one.
That's better than the
uh,
monkeys.
Yeah.
Much.
Yeah.
Ooh, after Travis the monkey, I don't like monkeys. I'm sorry. They scare me. I'm
Well,
not gonna lie, they do. It's an
you
irrational
just
fear.
solved how we quiet our brains, but now how do we bottle her?
Yeah.
oh, Sarah? Yeah.
Yeah.
Yeah, right.
I know, right? So see now you're just gonna have to send these mass
She could
voice messages.
just start a business that's like $20 for a voice message.
Yes.
Hmm.
There
It'd
you
be
go.
all our money,
I
but
would
like
buy
it would
it.
be
That's
so
okay.
nice.
Hey, she can make bank on Fiverr.
That's
Or on
oh
Cameo.
Yeah.
yes.
That's better than NFTs. Just motivational, like
Where
personalized
we're putting your
There you
future,
go.
don't pay attention.
What isn't better than NFTs? I mean,
Right?
right.
I do
Yes.
have to say I think a lot of people who are drawn in the community to each other, like we don't want anyone to feel the way we felt.
Mm-mm.
Mm. That's
You know, like I think that's like at the core of who I am. I'm like if I can prevent somebody from like being where I've been,
Right.
like I will wake up at 2 in the morning. I will stay up. I will make myself sick on an all-nighter for that person if it means that they never feel the way that I felt in my life
yeah.
at
Yeah.
my lowest.
and I mean that's ultimately how we as people lead ourselves to a brighter future. You know, we replace hurt with love and acceptance and compassion. That's not to say we won't be hurt again, but it won't be the same hurt because scar
Yeah,
That's
tissue
true.
always heals back stronger.
But
My
we also have
oh
to
wait, I
make
know what I was gonna say.
sure
Wait. I'm sorry, go ahead.
we have to make sure that we are directing that love and acceptance not only at other people, but at ourselves.
Right.
And that is the hardest
Right.
yeah,
part to do.
Mm-hmm.
Hmm.
And I preach it
that's true.
To Reese, but here's the part. Once again.
Well, the
Yep.
I can
hardest battles are
And I
always
think
fought in the
too,
mind.
yeah, because the I was just talking to my sister the other day about how trauma works in the brain because I was telling her about the shots and like
yes.
she was like, "What? I didn't know that you were dealing with like PTSD," and I was like, Well, yeah. But I was telling her the other day, I was like, the thing is, it's like it makes a scar in your brain, and it's not like you at 34 being triggered when you see something. It's like you at whatever age you were when you had that happen. And that's why it's like it's refreshing to be around people and like have the friends I have offline as well, where we'll just be like, sorry, I can't do this plan today. I had a bad flare up, or like, sorry, I had like memories resurface and I can't come out to your party, and people are cool with it. It's like I just started being open with my mental health because when I wasn't in my 20s, trigger warning, sensitive topics. Like I actually tried to kill myself when I was 27, and
Oh, I'm sorry.
um
988 988 988
and at the
988.
time they didn't have 988. It was a whole ass phone
Oh, yeah, I
number.
know, and then they put you on hold for 30 minutes. Yeah,
And well,
happened
I
to
was
me.
on hold for 30 minutes, and then I got somebody
Yeah.
who was basically like, "Do you have a therapist?" And I was like, "Yeah, but not right, like not in
Now,
this moment, you know?"
right.
And so
Help me find the light.
um yeah,
That
and so like I really, that's why I'm so passionate about talking about like my shitty ex and that whole situation, because I'm like, if I can if I can help other people figure out resources or find at least one person in their life. I mean, I had people that were there for me, but in that moment I was just like, when things get so bad,
Hmm.
yeah,
if I can
Power
like
has a point here.
Yeah,
Yeah,
Yep. Yeah, somebody
that's
can read
true.
it, please.
I can read it.
Okay.
Anyone that has received lengthy e-metering has been brutally compromised. Love them, but don't depend on them for accurate insight on how the con works.
Look,
Uh,
he
that's
I've been
the reality.
following this, and um all I can say is get ready,
Uh,
because that is correct.
You
Yep.
said get ready.
Yeah.
yeah.
I said get ready, because you know how we all have information and everybody, but when someone is determined, and I mean, I've been on his YouTube channel and watched the videos. I mean, how could it you just can't defy that.
Hmm.
So,
That's
yes,
actually something I had never considered before, but it makes perfect sense, and it's sad.
yeah. Um, I think you can text 988, can't you?
That's what I
Yeah,
was under the impression of as well.
you
I
can
think you can
text or
call her.
call
Yeah.
depending on your comfort level, because it's about, I think they have other, like, you could voice, just do voice, you could text, you can video, like it's kind of like whatever you feel comfortable with. um but I
Um,
agree, Red, like finding this
yeah.
community, I didn't realize how like much I would bond with people on just like a human level. I don't know if that makes sense, because like when you think about, oh, I'm learning about this cult, or I'm going out and protesting, or I'm doing this, it's like we're all people at the end of the day.
We're all
Yeah.
people. Oh, that okay, so my brain's back. Yes, I want to be like Tori when I grow up, I promise. Um, okay, so uh here we go again. It's gone again. Y'all, this is frustrating today. It's really frustrating today.
See, I refer to it as synaptic flatulence.
You're gonna have to email me that one.
Mhm.
I haven't had enough sleep
Brain
lately.
fart.
Yeah,
Brain
brain
fart.
farts,
That'd
but
be
just
another
in,
good
in fancy
t-shirt.
language. I,
Yep.
I refer to it as synaptic flatulence, and I don't call people airheads, but I will call them cerebroatmospheric.
I love it. I love
Mhm.
that.
That works.
And lack of sleep.
Well,
um,
That's
I did
great.
want to kind of touch on one thing that someone told me one time about trauma. I don't know if it's correct, but I'd asked them, I was like, well, I mean, as far as what it does to the brain, what do you think it is? And all they said was, it just means that it's happening again. You just can't see it.
Yep.
It means it is
Yeah.
happening to them again.
Oh,
It, it's just, it made all the sense in the world. It's
well, that
really
Love
makes
you,
that
sense with like
Ann.
the
simple.
Love you too,
definition
Anne.
of
Thanks for
Love
coming.
you.
Good night,
PTSDs.
Anne.
Sleep sweet, Anne.
I actually was
Have a
noticing
good
that
night, man.
in books and stuff that and verbal that people are starting to call like PTSI. And I kind of like changing disorder to injury because it is like
Mhm.
it's a chronic
Right.
well, I don't want to call it an illness, but like it's a chronic thing like you have to work through and
But I agree with you on the illness. It is. I don't like the disorder because disorders it's I don't know what I'm trying to say about that because I don't want to say the wrong thing, but
Well, it's just kind of
I like
gaslighting because
the
that's kind
illness because
that's
illness means you have a you're trying to improve and get better.
yeah. Because the term disorder
Right.
sometimes for stuff like that to me is kind
Yeah.
of gaslighting. It's like
Yeah.
they're trying to say you were born like that, or you fell into something you just couldn't figure out how to fix it or how to correct it. And it's like,
But
no.
you got to remember 20, 30, 40 years ago, we didn't even have those terms.
No, we
So
called it
that
shell
was
shock.
a way to come out and
Yeah.
say something. It was a
yeah,
nice way to
it
say it was
is.
disorder. And now that things have changed again, yeah, it's probably nicer to say illness because we're realizing, you know, okay, I have something physically wrong, but I have something wrong with my head. That's where my mental illness comes from.
Yeah, it was inflicted
And
on you.
I thought
Yeah.
it
right,
was. I
And
thought it was
it can be
injury.
in, oh, sorry, Don, go ahead.
I said, I'm sorry. I thought it was post traumatic stress injury.
It
Now
is
it's not
injury.
illness.
yeah.
Yep.
Injury. Yeah.
Injury.
Hmm.
But
And then
like
That's what.
part of the reason that they do that is because a lot of people were resistant to treatment for it or to the diagnosis because disorder makes people feel like, oh, I have a disorder. I'm weak. I'm not strong enough
I'm with
to
you. Right.
avoid that.
Stigma.
I'm not, you know, and an injury
yeah.
is something that has happened to you. It's something that is actually physical that can be seen in brain scans and they can see PTSI now, which is mind
Right.
blowing to me.
It is mind
It's
blowing
Right.
to
so
me.
yeah, it's
Yeah.
kind of a relief. Like I was diagnosed in my 20s or after my bad ex, but then I went to another therapist and I was just describing like a thing from my childhood and they're like, no, you probably had this from back when you were a teen and then you got with this person and the dynamic was like similar to the one you grew up in and then now you have
Hey,
stuff you
Carrie
didn't
Ann.
think was traumatic built on top of stuff that was extra trauma built on top of you lost your job, like cuz everyone thinks like, oh, a trauma
Right.
has to be something like physically harmful, but no, like you could be traumatized cuz your parents moved you to a new city as a kid halfway through a school year and
Right.
not get bullied or anything, but that move could be traumatic to you because you have to say goodbye to all your friends, you know what I mean? So,
It's an
it's
unjust,
so complex.
invisible
Right.
injury.
Yep.
I gotta go, everybody. My phone's gonna die.
Hi,
But it was
Heather.
Well,
great
have a good
being
night,
on with
Heather.
all of you.
Heather,
Yeah,
thank
Good night,
you
you.
too,
Heather.
And
Heather.
It's
Thank
good speaking
you.
to
I'll
you
see
too.
you in the chats.
Yes,
Okay.
ma'am.
Thank
Yes,
you.
ma'am.
Okay. Bye.
Good
Bye.
night.
Bye.
Yeah, this is like I mean, I can't even explain. I've had my thoughts, like I've had several thoughts that I've just lost because that's just the way my brain is now. The first thing is acceptance because I was how are you, Carrie Ann? I'm so
Hey,
glad
Carrie
you're over
Ann.
here.
Hi,
And
Carrie
Red, I'm
Hi.
Ann.
so glad you're here.
Hi.
Um, but so to me, I learned a new way to adapt. You know, I know that I have seizures. I know that I know this. I know that it's caused permanent brain damage because on my EEGs, they said if the back of my brain somehow, didn't improve on my EEG within 6 months, it's just permanent. So, um, and I've accepted that. And but the way I had to accept it was, okay, I used to have a photographic memory. I mean, I remembered every phone number from when I could remember a phone number and every address we ever lived at my whole life.
Hmm.
And if I saw something on a billboard, my mom would ask me, "Hey, remember 2 years ago when I could spit out the phone number and what it was?" My brain was just like, I mean, it just soaked up so much information. And I never studied for a test. I would never settle for anything less than a 4.0. But now that's over with. And I grieved it like you would anything else. And but then I came to accept it really quick because I went back to law school at 38. Why? Don't ask me because uh, I wanted to be an advocate for my patients, with mental illness. And I graduated. In fact, my cords are right over there that I graduated. But I went into a 3-week coma because of seizures. And when I woke up, I can't cite cases like you have to remember right there on the spot. And so I won't go take the bar because now it's just too late. But you only can take it twice. So I literally had no faith in myself. And for all good reason, I was hypoxic. They didn't think I was going to make it. I mean, I was on hospice. And my mom said, I'm not burying my child. Everybody in the family was called in from what they told me. Everybody. And
Now Kayla talking about a
they
brain
were all calling
injury,
my mom.
and she was still good enough to get up
Huh?
to the bar. Like,
No, I don't. My memory's gone. I've learned to adapt to that. So I carry notebooks like everywhere I go and make sure that I write. But that quick from when that was said, it was gone. Now
Yep.
things from the past that are not short term but long term memories. Yes, definitely can remember that still some of that, but not. And a lot of that's got to do with you know, the childhood trauma and I mean, I still say CPTSD, whatever it is. But going through EMDR, and I didn't get to finish it because my insurance messed up right in the middle of it. But I did clear some things, and I'm thankful for that. But so you just learn to adapt. It's just like any other illness. Your brain is part of your body. Doesn't matter. I have a doctor that actually she treats all psych and medical. She that way
They're
medications that
linked for sure.
interact, if things interact, she knows it. I don't have 20 doctors prescribing all this stuff and something's not, jiving over here with it. She knows exactly what I'm on because she prescribes everything I take. And I think it's a lot better that way. Um, and Dr. Gaber, I don't know, everybody says his name different,
Gabor
Monte or
Mate.
whatever.
hmm.
Yeah, I didn't even know about him, but my therapist,
He's amazing.
she girl, say that again because I'm going to tell you something. You want to know about caregiver burnout? You want to know
Mhm.
about why we all are sick and how we get sick in our adult years? You want to know why? Read his book and then watch some of his lectures. He's on
Yeah,
YouTube. It's
I love him.
GABORMATE. I love him.
Gabor Mate, I read his book In the Realm of Hungry Ghosts when I was working at the residential treatment center.
Really?
And yeah, yeah. And it was amazing because
Yeah.
he's talking about all these different modalities
Environment?
they use
Yes.
to help these people. And I was working at a place that claimed to be multimodality, but was nothing but 12 step all the way.
Right.
And reading his stuff and realizing that I'm not a renegade for thinking this way. Somebody who's an actual medical doctor and is preeminent in his field,
Yes.
thinks so much the same way that I do. I mean, his writing is absolutely heartbreaking,
It
but
is. It
it's
is.
also mind blowing in some of the best possible ways. I cannot recommend him enough. The man
Me
is
neither. He's
he is
great.
a
Yeah, I mean,
superhero.
if you don't want to read, all you have to do is he's got so many lectures on YouTube.
Yep.
I mean, you literally aren't able to pull yourself, like I can't pull myself away from him if I start watching one or TED Talk or whatever he's on. He is so great at what he does. Like he didn't want to be. He was a physician. He did not want to be a hospice nurse. He didn't want to be palliative care. He didn't want to work in that. But he ended up filling in for someone and ended up in palliative care. And then he started seeing, like, putting it all together. In the book that I read, the first book I read by him was When the Body Says No.
Mm-hmm.
So, and it's caregiver burnout. And because I was going through that.
That's very real. And it's sad to see. Like I remember when my grandfather took care of my grandma because she had MS and I think dementia or something. I can't remember, but he took care of her for so long. And then, like, the first year after she died, he got really sick because he had been in like crisis mode for her for so long that he had just
Yes.
like not taken care of himself. And yeah, it was just interesting. It's interesting looking at like certain countries and how they approach it as a whole instead of like splitting everything in 5 different ways. It's like
The Body
our
Keeps Score.
head
That's the one I read. That's the
our
one I
like
read.
head is attached
Yeah.
to our body, right? So like why do we treat medically that it's just
That's the whole point of it. Hey,
I
Jim
was
and I
just
girl.
yeah,
thinking about that. The stigma that there has to be physical
GABORMATE. Is
evidence
that
or
right?
proof.
Yeah, GABORMATE.
Yeah.
what were
Dr.
you
We
Gabor.
saying, Blake?
Yeah,
Pardon?
the book is actually called, Carrie Ann read it. It's, The Body Keeps the Score. Yeah.
Yes.
Well, I was just touching because I was really thinking about that heavily a couple seconds ago. It's one of those things that I'm really fiery about is the fact that there is still this stigma or more that there has to be some kind of physical evidence or this morbid kind of proof. Like when it comes to the mind and mental health, uh, you're always expected to get over it somehow, to figure it out, to deal with
Oh
it.
God. I just had this conversation, Blake.
And it's like you break your leg and you
It
have
you go
nothing or no one.
That's right.
Are you expected to just
There you go.
surgically know how to operate on it right there, wherever it is you are, and fix your leg? No,
Everybody.
when it comes to your mental health, you're pretty much left on your own.
So here's, because of working in this field for so long. Here's here's my thing on this, and that's why I liked him so much, because you're right, Blake. What you were saying. Um. Okay, so you have your brain, you have your pancreas. Let's just go there. Okay,
Mm.
you have diabetes. That's, you don't get shamed for having diabetes. You can't help that your pancreas isn't making enough insulin, correct? I mean, but so you, oh my God, I just heard that today, Heather. Please
I
remind me of this thought right here in my head, so I can finish this one. Um,
Got it.
I, that's
hate that
exactly what I
phrase
just got through in there.
so much.
But he teaches that, okay, so you don't have enough dopamine, you don't have enough serotonin, you don't have enough norepinephrine or epinephrine in your brain, all the feel good and the stuff that makes the brain work and the synapses. Okay, well, how is that any different than your pancreas? Your brain is part of you. It should all be treated. That's where the stigma comes in, and that will lead me into what I'm fixing to say right here is um my other
Pull
half works.
yourself up by your bootstraps. How about I
Yep, I
break your
just
nose,
heard that.
punch you in the face, and tell you to fix your own nose? How about that?
How
Look,
about I break off my bootstraps in your ass?
y'all, literally 10 minutes ago, I just had this conversation in there. Or, well, not 10 minutes, but right before I come on. He was like, we were talking about men.
Oh,
I
I
said,
hate that
men's
phrase.
mental health is a big thing that nobody talks about. It's always mental health or what a woman's going through or whatever. But and he said, I was raised he's 50, I'm 50, he's 57. So he's like, I was raised where you that's weakness. That's a sign of weakness. You don't have those problems. Men need to pull their bootstraps up and get out there and go to work. And I'm like, no, that's really not how it is.
Yeah.
But I can't
Okay,
make
so
someone that doesn't want to change.
in scenarios where people do that, okay, they pull their bootstraps up, they go work for 8 hours, and maybe now they come home and trigger warning, beat the crap out of their wife. Or now they go to the bar and drink because they don't have anyone to talk to and they're told to just handle it, but given no tools or concepts of how to do that.
I just had the same exact words there.
Or they
And
go and hide under their bed because they can't afford bootstraps or strong enough ones to pull themselves up by, or they just simply don't have any. I mean, it's one of the most ridiculous sayings, and I really hope that as we move forward and as we keep learning more,
Yeah,
that
Carrie Ann, that's
that
true.
kind of mindset will fuck right off into the forever.
I hope so too. I
Exhausting.
really
Oh my
hope.
gosh, Rika, I'm so sorry.
Rika. Oh no.
Oh no.
Um,
Yeah, would you tell
I'm
that
so
to
sorry,
somebody
Rika.
who's struggling? Like,
And that's what I said. What happens when someone is already on that line and they're told that, or they may not be told that in those exact words, but that was funny that that is the exact same words. I mean,
Mhm.
exact. And I mean, I'm
because,
like,
like,
diabetics
they,
take insulin. So, if you've got something wrong with your brain, you're going to take the medicine to fix it. You might not get it the first, second, third, or even the fourth try because you can't just take a picture of your head and know it's a broken bone and know what to do. They have
Oh
yeah,
just
yeah,
like
and
the
the
on
insulin,
the
vitamins.
you have to
topic
Go
find the
get some.
of like when you're on that thin line, like honestly, I like showered every day, I ate every day, I went to work every day leading up to the attempt, and I had read books saying like people talking about how you feel this like euphoria when you make that decision, like when you know that you're going to do that, and like those 2 weeks, this sounds messed up in retrospect, okay? It's why I'm in therapy and have a psychiatrist.
No,
But
but I
those
mean,
2
it's
weeks
fact.
were the most relief and the most happy I had felt up to that point in my life.
Sure.
And having lived through that and being here now, and then having like my car accident when I was 27 where I got T-boned and like blacked out and everything, it just kind of made BS not matter to me. Like, oh, I have a shitty coworker who hates me. Doesn't matter. I survived. Like now I look back and I'm like, you know, I got a tattoo on my wrist to remind me, like, I'm alive now, like,
Yep.
Yeah.
And
Semicolon
there's
project. It's
Yep.
and
upside
there's
down. Music is my therapy, and there's my semicolon project.
oh,
Mm.
Damn right.
yeah, that's true. It's
yeah,
so much harder
and
on
there's
that
some
community.
Kate Delight has an excellent point right there.
Yep. I
And my
can
best
read it
friend
if I want.
is black, and he went through a lot growing up. He went through a lot, and he is the successful businessman he is today in a corporate office working as an HR specialist because he addressed those issues. He allowed himself to heal from it. He didn't ignore it.
Yeah.
So that is a key indicator that those issues are there and they are being ignored.
Exactly.
I knew,
Yeah.
it's like I,
That's, I
I
mean,
knew
it's,
somebody that, sorry,
go
I was just
ahead.
gonna say, I knew somebody that his dad was, he had several, like bipolar and a couple other things, and his dad would tell him, it's just all in your head. He's like, you're right, Dad. It is all in my head, but not in the way you're thinking, not in the way you're saying. But his dad was one of those. He was born in 1940, raised in the country, and he was one of those that you just, you know, pulled yourself up by your bootstraps and kept going.
That's exactly right.
Can I quote one of my favorite books because we're talking about being in your head? And I know no one likes the author, me neither, but this book literally saved my life a couple times. And then Harry looked at Dumbledore and said, "Isn't this all in my head?" And Dumbledore said, "It is, but it doesn't make it any less real."
Mm.
that is
Mhm.
Because we live
exact-
with ourselves every day. Like our experience is real to us. You know what I mean? So,
our perception is our reality.
And it's like, how do you help yourself in any way when you're trying to communicate that you think nothing is real, or every time you try to have a positive thought, it immediately is inverted on its head, and it's the worst thing you can even think about. And then the person you're trying to talk to tells you to just stop, to stop thinking negatively, to start thinking positively.
Okay, well, first of
Yeah,
all,
sure, because it's just that easy.
it's just that simple.
Yeah.
I'm just going to decide to
And it's
stop.
like, you missed the point. You missed where I told
They
you
always do.
that that I'm not the one doing it. I'm trying to do what you're saying first and foremost, and something else is happening.
Yep.
What is that? There's me and something else at play there. No, I still struggle with it today.
Yeah. I think it's
Yeah,
something that a lot of us struggle with.
I deal with a lot with I deal with depression and anxiety and stuff too, and I get told a lot of you just get over it. Just don't you don't need to be thinking negatively.
My
You want to
mom
get
used
in
to
my
be my help.
Would you like to
My
get in
mom,
my
why
mind
don't
and
you
change
just
that for me?
why don't you just
Yeah.
why don't you
my
just
mom,
smile more? Because I don't freaking feel like it. Because I put a
that's right.
smile on my face for 3 months and 2 weeks before I
Yeah.
went to the dark place, and it
Help
did
me.
effing nothing to change it.
Help me from people
You
who
know,
tell
like,
me to smile more.
Yeah, like if you have a
Yeah.
problem with me, just say that. Don't tell me to smile more. Like,
You should just smile more. It'll feel so much better.
yeah, because
Yeah. And why
yeah,
don't you
and like
step in
everything
my place and
you
the
know,
same thing?
everything's fucking peaches and cream. Oh,
because I
sorry,
tell
bad
people
word.
too, like
You're welcome.
the other thing that bothers me is people say like, "Oh, if you're just in a bad situation, why don't you just get out?"
Yeah.
I'll tell you
Easy
why.
that is.
Because,
How,
not
yeah, that's
everybody is
so easy.
blessed. Like, I'm very blessed to have the parents I have. They see how hard I've tried to work.
Me
They
too.
help me. You know, I'm moving back in with them next year because I can't afford my medical bills and my own place. I just can't. But not everyone's that blessed. Not everybody is white. Um,
Yep.
that makes a huge difference. Not everybody can
Sorry if that's
speak
really
English.
glary.
That makes a huge difference. Like there's so many privileges I know I have, but it really bothers me when people who are and it's not always people being bad, like trying to be mean.
Right.
They're trying to understand, but it's like
Yep,
some things you
that's me right
can't
there,
unless
Heather
you've
Mac.
been
I'm right
there.
there with.
Yeah. I mean, that's it right there.
Yep.
That's why we're here.
Oh, okay. I
Yeah,
got a
Heather, that's
question.
true.
And And
Sharon.
Indigo, I'm sorry, I was just gonna say, I'm sorry, I didn't mean to cut you off, Keela. I was just
Oh
gonna
no,
say,
you're fine. I can't even see this. Somebody's gonna have to read
Yeah.
it anyway. My eyes are so glazed
I
over. I'm
can't
so
see it
sleepy.
either. I can't see it
Gotcha.
either.
I
But
can read it.
Indigo, I understand exactly where you're coming from. I don't know what I would do if I didn't have the parents I have. I mean, the house I live in, they own it. My parents are my landlords. Um, and honestly, like with my first
Sorry, not
marriage,
yelling at you.
I don't know how I would have ever been able to afford to get divorced without my parents, because the lawyer told me how much it was, and I was like, "What?" I looked at my dad was with me, and I looked over at dad. And I said, "I don't." I said, "We're gonna have to wait until we can save the money up." My dad said he hated my ex-husband. He was like, "I got my checkbook in the Jeep right now. Let me go get it."
Yeah.
So
And I
what
think
Shannon Norris said here is
So
question.
Shannon says,
Go ahead.
oh no, you were gonna read it. Go ahead. I was just gonna read it.
Question: have any of you ever like fought with yourself, like in your brain, like literally argue with yourself inside your brain, or is it just me?
yes.
It's not just you.
All the
Not
time.
just you.
Oh, I say
Not
yes
just
because
Not
I'm,
just
I'm
you.
agreeing that I do that.
Yep.
All the
hey,
time.
the first step to recovery is
Yeah.
admitting you got a problem, and I got it.
Yep. I
So,
sure do.
And
I
it's
literally
like
I
talk to
mean,
myself, like I said.
the worst person who ever gaslit me is myself. Like I um wisdom, right?
Yep.
But I had a situation in a different online community through YouTube where I saw the red flags and I went, okay, this is not your ex. It's a totally different person. This is not the toxic roommate friend that you no longer talk to. It's a different person. And I ended up in the middle of like this person's like meltdown explosion like thing and ended up really hurt by the situation. And then at the end of it, I was like, why did I talk myself out of the red flags? Like I saw them and I was like, give him grace. He's not your ex. And then I was like, no, don't be hard on yourself on yourself for that, but
I'm not
it's
sure
like,
there's a clear answer for that because I've asked myself the same question recently. I think it goes back to that kind of cheesy philosophy. Everyone's innately good. And I think that comes from the want or the need to have the love that you have for someone else be felt by that person. And I think a lot of times people exploit that and they give off the illusion that they're meeting that need when in reality they're taking advantage of that.
yeah,
And like illusions, they never last for long and they hurt you in the
right.
end most of the time.
you're so
No,
wise.
you
He is
are.
so
Well, thank
wise.
you,
I'm
man.
so
I
sorry
appreciate it.
I'm so sorry you ever felt pain. It's not fair.
Oh, I feel that for all of you. I feel that for
You,
all of you.
I'm so glad I found this community here, because honestly, I mean, my husband gets me most of the time, as much as much as husband can. But I've never, besides him, I've never found any other group
Hmm.
that understands me.
Right, Power? I
Yep.
agree.
Yeah.
So,
You know,
Gemini girl, I'm gonna try this. Gemini girl, comment. I also argue extensively with others in my brain, like what I want to say as opposed to what I actually said.
Yes.
yes,
Oh my
That
gosh.
is very, very common if you're non-confrontational. If
Yep.
you don't like conflict, it's
I'm
easier
very,
for us to beat our own selves up and do it in our head than go actually have that conflict. Guilty.
And
that
I do
makes
I
want
had
so
to
a
much
say,
therapist.
sense.
that gets better because someday you don't even have to snap to take that leap forward. you might just be like, okay, after all of this internal fighting, I know what the right thing to do is, and I'm going to try it. And I did that recently, and it was terrifying. I
It
hate it.
is terrifying.
Emotional.
Boundaries are terrifying.
I take forever to get my words out, but the message that I had was received. And while things kind of gave off the perception that things still weren't okay between us, a couple hours later, what I got back from doing that was respect. Respect that I had brought it up, that I had a problem, and that we talked it out. And we were perfectly fine after that. I think they respected that I was able to do that.
Yeah.
I think cricket. Didn't you have the? Didn't you have the that?
I had to have a difficult conversation with somebody recently because they spoke to me in a way that I did not deserve.
Right.
And advocating for yourself
That's
is
exactly what I did.
so hard sometimes, and it's absolutely terrifying in the moment. At least it is for me. It is something that gets a little bit easier with time, I've found, but yeah, I had to, seek out a conversation with this person and just say, hey, you know what? I respect y'all, and I have never wanted to come across in any other way. But the way that you spoke to me a couple of days ago, I didn't deserve that. I didn't do anything to deserve that. And I'd like to know what I can do to maybe clear things up or clarify my intent or meaning so that this doesn't happen again. And I told them straight up, this is terrifying. This is a terrifying conversation for me to have. But I have to.
Yeah.
And,
And
and it's that first step that is the hardest. It's like that. You're. I mean, like boundaries with my mom. Don't scream at me. Don't holler at me. Don't cuss me. That's just simple as that. I don't do that to you. You never raised me that way. You raised me to respect everyone, and she always raised us that the only person we're better than is we need to be better tomorrow than the person we are today,
yep.
and that's all we better be better than.
I had
You know,
someone tell me one time because okay, really quick in the chat, I just want us
oh, go ahead.
to
I'm looking for.
acknowledge I gotta scroll here. Sharon really quick. It doesn't hurt if you want to reach out to a therapist. They can't prescribe you medication. Psychiatrists are the ones that can prescribe you medication, but both are helpful. And I don't know, like find what works for you. I've had several therapists who weren't the right fit for me, but just like my new primary doctor told me, if you're coming here paying me for a service, I need to work for you. If you go and you look for a therapist, you can go in that first session in your mind being like, I want somebody who's, I don't know, like for me, I was like, I need somebody who's LGBT non-binary educated. I need somebody who's DV educated. I need somebody who's XYZ. And I just looked online and found found another therapist. But if the first one doesn't work out, this is a horrible use of this phrase. There's many fish in the sea. Because the first one you might find might not be the best fit. And the fit can change, like the slipper can change because you might need somebody later on. You might find someone who's really good for 5 years, but they're not a deep trauma therapist. So it's like it's a changing journey.
Hey,
Yeah.
I have
Yeah.
a question.
I'm sorry.
Because y'all know I'm all new on this. I found something that's a 9-minute summary of when the body says no. Will I get copyrighted if I share if we
I don't know.
I don't think so, because if it's a summary of like bullet points, just as long as you're not like
Is it a
we're
video
kind of
summary?
it's for when the body says no, it's just says a 9-minute summary. I don't know. I was
So
gonna
is
try
it,
it.
you don't know if it's video or audio?
It's video.
Oh, okay. I think if you, under fair use, I think if you stop it every X number of seconds or
Okay.
minutes and make commentary,
Okay.
then you're not playing it just straight up for your own use.
yeah,
Yeah,
and I
because
think
I
because we've been
want
talking a lot about like mental health and the book in general, like in an educational way, um, you might not get
right.
copyrighted if you kind of like use it in that way.
Yeah, because I mean, you're not claiming the work to be
Not
yours.
no,
Right.
no. This is actually this is called Snaptail audiobook, but
Okay.
it's just a summary of Dr.
Gabor Mate.
Gabor. I'm gonna say it right one day. Yes. Um, and I didn't want to play the whole thing. There's one certain part at the beginning that he talks about how we become sick and have all these illnesses when we're older in our life. And he takes your environment and your parent, your environment, your as your child. I mean, it's really interesting. And I'm gonna try not
Matters.
to screw this up with
It
the audio.
matters.
I'm really gonna try not to screw this up. So hang
I gotta go, y'all, because I gotta go and get ready for
on.
my own show.
Yeah, I'm gonna be
Bye,
getting off
Cricket.
soon,
Oh
so I don't
yeah,
interfere with your
Yeah, I have to
cricket.
go too because I have to wake up early. I'm sorry.
Oh, it's
Ew.
okay.
yeah,
Bye,
I have to
Blake.
go soon too.
Well, have a good night.
It was
Bye,
good to see you,
Blake.
Blake.
It's
Thanks
good
for
to see
having me
you.
Bye,
on, y'all.
cricket. Thank
Hi,
you.
y'all.
I love
Yeah,
y'all.
same.
Love you
Love
Mwah.
you,
too.
I
Blake.
love y'all.
Bye,
I love
y'all.
you back.
You want to talk? Apparently, she's got something to say.
Huh?
Apparently,
Okay.
Bella has got something to say.
Share screen. Let me try
She
this
says, "I
one
wish
more and
I
hope.
could snuggle all your friends, Mom."
Yeah. Oh,
Okay.
well, Skylar that y'all met earlier, Oreo's little lookalike. This is her
Mm-hmm.
sister. That's her
Oh,
sister. Their mama was a pregnant stray I took in. And here's their brother, one of their brothers. That's Squeaky.
you have they look so soft. I miss having
Oh, he is.
pets.
Wait,
Well,
Heather, there was something I have. I had it start up there, and then I found this. She was right about, when someone's like on the edge, don't tell them, hang in there. Quick story about that, which is really sad, is right after my sister found my brother-in-law, her brand new husband, that doing exactly that way. Everybody that come up to her was saying, "Oh, hang in there," and then they feel like so horrible. And I was like, she didn't even she didn't even hear it, you know. I mean, it was my baby sister, and she just lost her husband.
A
But
a
this is
great tool I used after I left my bad ex, and people would be like, "Oh, why'd you leave him?" And I would be like, "This real reason, right?" I could see on their face that I was like, "You don't need to react. You don't need to give me advice. You don't need to say anything. You asked a question and I answered the question." And it kind of gave me the ability just to be fully transparent with people and, give them the room to hear what I had to say without feeling the need to try to make me feel better.
right, right.
Because you're
What
right. There's
is
nothing you
all
could
of this?
say to someone who lost their husband, like,
No. Okay, there we go.
so.
All right, I'm gonna play. If look, here we go. First time. I guess it's gonna be good to get to practice here, right? Um, thank you, Blake. Thank you. Okay, so if you
oh,
can't hear it, let me know.
Thank you, Blake. Have a good night.
sorry, I can't see the
Can y'all
chat.
hear this? Y'all can hear that?
Yeah.
Yep.
Oh, I can. Yeah.
Gabor mate, when the body says no, exploring the stress disease connection.
I'm not gonna play all of it, but it's
Are you
really
aware the risk factor for heart disease is job strain? Contrary to popular belief, the mind's inner workings have a significant impact on the body. The book, When the Body Says No, Exploring the Stress in Medicine,
great.
opting instead for psychoneuroimmunology, the study of connections between physical and mental health. This book summary delves into this fascinating field, elaborating how our daily experiences and stress can affect the immune system and how stressors can cause chronic illness. It
Mm-hmm.
also explores how
Mm.
stress confuses the body, causing it to attack itself, and the role environmental factors and destructive coping styles play in the onset of disease.
So right there, I mean, there you go. He,
Yeah,
this.
I did
I wish.
like
I w-
100%.
And I know
yeah.
when I'm stressed,
I don't
it
like this.
messes with my
I,
stomach.
Yeah, I look back
huh?
and it's
So
like,
I know when I'm stressed, it messes with my stomach. You know, make I can get sick for several days just for being stressed.
I
Yeah.
look back and I kind
Yeah.
of
And
wonder how I made it through college, to be honest. With the amount of, um, like all of my mother's siblings died before I was 30.
I'm
So,
sorry.
yeah, so I say
wait.
like, grief causes brain fog as well. Um, I mean, you hear of the 7 stages of grief, right? Like it's 5 to 7. It's
Mm-hmm.
a
But you,
process,
oh,
but
you're never gonna be stuck. I mean,
and
you're
I
gonna
and
be out
I,
for a
I
while.
at this point
No.
in my life, it's given me a fear of like I had to tell my parents recently, like I cannot acknowledge that my parents are going to die. Like I can't do it. Like in my brain, I'm just like,
I
nope,
have one parent left, and I'm
you're
just
gonna be alive forever. But to say like having all of that grief happen when I was for 4 years in college, and then the first 3 or 4 years I lived on my own, and then I had a bad ex, and then I was living by myself, and it's like I look back and I'm like, "No wonder I probably developed chronic illness." Like, how does a kid's brain? Because like, I don't feel like I really became an adult till my 30s, which I'm in right now, and I'm like,
when am I
like,
gonna say how old I am?
how did I I'm
Mm.
34,
Like,
but
when am I gonna get
I feel like I'm 80, but I'm 34. But like inside I feel like I've lived 80 years and 34 years, you
it?
know. So
Mine is.
My mom,
Let's
my mom's stepbrother. Um, I think I was probably 6 or 7. My mom had her stepbrother um removed himself. And I'm
It.
told I'm told I was very close to him. Like, they said as soon as I saw him, I would make a beeline for him and run and climb up in his lap. I was all about Uncle Mark, and I don't remember him. I have, I remember a lot of other things from when I was that age. I don't remember him, and I really think that when he did that, I think there was I think some part of my mind blocked him out. I
That's
don't.
it's
called
a big pain to
self-preservation,
have
and our
young,
mind
yeah.
does that. Mhm.
I think just as a little kid, I didn't know how to handle it, so I just blocked him. You know,
Yeah.
And
That makes sense.
compartmentalizing early, and my mom raised us that way. And I said, "Well, I think all my compartments busted open. Now I need to see a therapist because I couldn't put anything else in them." And my therapist said, "I never tell my patients to compartmentalize."
well, one thing I do remember is I remember, my dad. Most of my family's in Florida, and my dad was actually in Florida at that time for work for business stuff, work related stuff. And my mom called him and told him, that Mark was gone, and told him what had happened. And he said, "Mark, who?" Because he was shocked because he said he had been out on he'd been out fishing with him the weekend before, and Mark was talking about future plans and how he was planning on going back to school. He had this, you know, he was about to get his dream job, and he was just all happy and excited for the future. And Dad said that when Mom called and told him that, he couldn't believe it. You know.
I know he's probably gone, but Blake is again. Wisdom comes from pain. I really feel like that's a true statement.
Hmm.
But Blake said, it's why I advocate for mental health, pay it forward. Helping someone else's mental health will always improve your own, and an echo is
Yeah.
created. That's what I remind myself about this movement, guys. Like, every person who leaves the cult is traumatized. They're at a different part of their journey. Their brains are remembering, because, like you said, compartmentalizing can be a negative coping strategy, because
Yes.
all you're doing is locking away the thing you're not.
And
And
that's exactly right. You're just
I'm going
putting
to
it
preface
away.
this by say, like, children don't have the tools, and like, unless you were taught to like understand that 10 years from now I'll get away from the bullies and I'll have friends and I'll meet great people and I'll have a better life, right? Because you're a kid. And so I feel like what people need to understand is these adults are not talking about these things happening to them as adults. Every time
Right.
they talk about it, they're talking about things that happened to their kid self. And it's incredibly hard work to go to therapy and imagine, like, that the therapist will be like, close your eyes and imagine that you're in a room with yourself. And you're 34 and yourself is 8, and you're just gonna
Yeah.
you're
So,
just gonna give yourself a hug. And that is so hard for people, because to do that, you have to tear down all those walls that you built to protect that person.
and then you're
And not
vulnerable.
only are they doing that online, on video, posting it, they're going out to the physical places that did this to them.
Wow.
Just the level of that,
Wow.
so just
Can't even imagine.
remember that in the chat when people kick out trolls or kick out people who aren't following the rules. We're not mean. We're not having cult behavior. We are protecting people from being
Yes.
re-traumatized more than they already are.
Yes,
Good
exactly.
Lord, if we ever needed to hear that.
And not
Definitely.
just them either, like us as viewers and never-ends. I mean, look at how much we learned about each other tonight in almost 3 hours. Sorry, Keela, it's almost
Oh, I'm
hour
fine.
3.
Hey,
Um,
this is the best I have felt all week.
but you know what
And
I mean? But
honestly,
it's that, that's why in chats I'll say, "Sorry, I have to leave." I felt so bad. I think in one of T's earlier chat, she talked about something she never talked about. I'm like, "I'm really sorry. This detail is too much for me. I have to leave." And she reached out to me and said, "I'm really sorry." And I'm like, "No. I'm responsible for knowing again, this is for everybody. You are responsible for your triggers
Yes.
and not anyone else. If you're triggered, you can turn off the video and you can come back a different day. And just remember that no one will judge you for leaving the chat. If you can't handle what you're like, even tonight's chat, if people had just been like, this is too heavy, and the chat had 0 people in it and we were still talking, that's 100% okay,
Right.
because that's the thing. You never know. You could be triggered by something that you've never been triggered by before.
I had something the other day that, I'm not normally easily triggered. I was moderating a chat, and I'm glad there was other mods in there, because it's just something small that just triggered some bad memories for me. And
Right.
I didn't want to be the one to say, because
Uh-oh, it's you. There you go.
you know,
Oh, no.
I didn't want to be the one saying, "Hey, I can't talk about that right now." I felt bad being that person, so I was just like, "Hey, I've got to step. I've got to step out." I think I did explain later, but yeah, it's sometimes you have to step back for your own mental health.
And
Yeah.
that's true.
And
That's
that
true.
goes for the creators too. Like, if any of the creators see this later, if you wake up and you planned a live and you're not up for it, you have thousands of video of watch hour on your channel. Take every single minute that you need. Reschedule a call. If you're not, if a family emergency came up, if your dog needs to go for a walk and you'd rather do that, you don't need to explain it. You can always reschedule a video interview, but you can't reschedule your life.
That's right. No, that's perfectly said.
One thing I've had to learn is not and I'm still learning. I'm not very good at it yet. Is not feeling stupid for being triggered or not. I mean, it's like there's a part of me that knows it's not stupid, but then there's a part of me that's like, that shouldn't upset you. Why are you letting that get to you?
Okay, so my answer to that is if it gets to you, if you have a gut feeling, if it upsets you, if it makes you feel any kind of way that's not your and I don't like the word normal, but that's not
Typical.
your baseline center, and you feel off on that, trust it. Just
Right.
trust it.
And it's like for me, I mean,
Hey, so
sorry, I was
no,
just gonna say I had childhood memories of, people, just people planning stuff around me, planning all this to do all this fun stuff, and I would be the kid that was left out. And for me, that was really traumatic as a kid. I mean, right? I mean, probably now I wouldn't care, but but as a kid, that was so traumatic for me. And just something small in the chat the other day just brought all that back. And I was like, I think I really need to step out. You know,
and you did it with grace, and you just eased out, and you knew what triggered you, and you waited, and then you came back.
yes,
So, and that's what we all have to do. Like, I had to leave Maryland's chat one day because I was actually in the middle of EMDR on child essay for the child essay, and um, I couldn't do it. I mean, me and Marilyn and I, we were raised in the fundamental, you know, people say cult,
Christian
I say
sphere.
church, whatever. I was raised in it, and the men do no wrong, and it's always the woman's fault. And it doesn't matter if that woman is a 10 or a 13-year-old girl. So, yeah. So it's everywhere. And I had to step out of Maryland's chat because I just wasn't ready to deal with that yet. I mean, I'm 50 years old, and I finally was able to start. I think what did it, and it was so weird the way I was like thrust into the same building with this man for the first time in all these years. But I didn't want to be there, but I had to be there for one of my family members, and that is her family member, and I pretty much was made to feel like crap if I didn't go. And so, hey, Chuck, thank you. Yeah, I say, I just say because I have a psychiatric facility, and the word normal really freaks them out. I just tell them, honey, nobody here's normal. The only thing we got here normal is the setting on the dryer, and that just tends to get them to laugh and get their mind off of that. Them trying to distinguish themselves that they're not like everyone. But yes, I had I the reason I say guilt is a useless emotion is because first of all, it's the first emotion people play on you. The very first. I mean, think about what is the first thing? A guilt trip. Well,
Yeah.
but but I would feel better if you would come. I mean, or I did this for you. Why can't you do this for me? I mean, it's always trying to play with your emotions, the guilt. And I went. I didn't want to. It took everything I had in me to go. I did not want to be there, but I wanted to be there for my other family. So I held on to Daryl's hand and I was sweating. I was shaking. Thank God I didn't have to see him until, he was coming down the aisle. But when I did lay eyes on him, it was the most liberating experience I've ever had in my life because I didn't see the monster that hurt me when I was a child. I saw a frail old man that karma has had her way with. And that's just, I don't even have to do EMDR on that part of
Yeah.
it.
I've been
So,
thinking about doing EMDR, but my one thing is that's another reason I wanted to move back with my parents is because I've had more memories from my childhood come up, and I feel like if I'm gonna really kind of like
mhm.
dig into that, um, I want to do it somewhere where I don't have to pay the bills.
Well,
'Cause, like, the
you,
stress of having to, like, balance my
yeah.
budget so I can get mental health help and pay my rent is just causing so much stress, but I'm like, I think I really need to, like, do some deep healing.
Well,
So,
in EMDR, they do, like, I had to go through this we had to go through almost a 6-month process just to get to where we could actually have our first session. I had to write down so many negative core beliefs, and what I wanted to try to transform those into. Hey, just as I am. No, but I am very interested in that. I like that. The EMDR is slow. I mean, it's a very slow rerouting process. I had a
yeah.
hard time with holding the cans. It reminded me too much of what we're fighting. So I chose not to use that method, but I did do the tap and or on my knees. I did the eyes. It didn't mess with my seizures or anything, but it didn't. I wanted my eyes closed to remember, and I had to close my eyes to actually. And if you're going to use your eyes, you can't because you're looking back and forth with them. So
Yeah.
I just decided to do the tap until she says stop. And what are you thinking now? I mean, it is so parallel to auditing. Stories we've seen in auditing. It's so parallel to that.
From what I
And
understand about psychology is he basically took psychology
mhm.
and changed words, basically,
and
and then
exactly.
manipulated it.
So, and holding the cans, I mean, that you can hold on to that in EMDR. But I liked having the control over myself, and she tells me when to stop, open my eyes. What is it now? What you started at 10 and you're at least wanting to clear down the first 3 sessions, to like a 3 or a 4, and then you want to try to clear it to 0. What I did clear was that I'm fixing to get you, Katie, and just as I am. What what I came to understand from all of it was,
It's
okay, so my question in my head was, and and you have to go back to the first memory. What does that sound like? I mean, how weird is that? You can't start at a memory here. You have to go back to the first memory of that situation. I was like, man, what kind of therapist? What kind of therapist? I actually got on the computer. I was like, wait a minute, sounds awfully familiar. But it's EMDR, and the therapy, and it. But what it did is I knew what my first memory of that was, so that's why I think it was one of the easiest for me to clear. Is after my mom did not have custody of us whenever, or of me, whenever all of this was taking place. I had to live with the person, and I couldn't escape. I mean, from 8 to 14, there's no. I mean, so but I told my Sunday school teacher I couldn't do it anymore. You know, I couldn't take it, and I was really mad. My mom's psychiatric nurse, and she actually had me committed to where she worked at an adolescent psychiatric hospital. And I said, I'm getting locked up when I don't do anything but make straight A's, go home. I have to put up with this. I went. they really wanted to find a way to put me in. I gave it to them. I was pissed, but I've had that grudge against my mom for all these years, and I realized all she did was help and save my life. She got me away from him the only way she could legally, because she couldn't
Yeah.
just come take it. She didn't have custody. So
Yeah, because if she tried to do that, they say she was kidnapping you. It'd be a whole
exactly.
thing.
So what my
Yeah.
mom did is save my life, and I've held a grudge on her for all those years for locking me up as a victim or a survivor or whatever you want to call it. At 14, and he's walking the streets, has never spent a day in jail. And I'm like, how is this? How is life even like this? I
And
mean, I was really
there's
jaded.
a lot of people fighting in different states to get rid. The problem is there's no federal. All the statutes of limitations, they're not federal. They're state
No,
by
but
state.
Texas has, if there's two or
But
more children in the same house with the same accusation for the same person, there is no statute of limitations. And I just
what
found
I was
out
gonna
my
say is there's
brother
people making
just
real progress to get them just completely taken off the books.
there should not be a statute of limitations on
I
that.
agree, but like there's people fighting in state by state to get them repealed basically and explain that like I had no choice but to be brutally honest about what happened because I had to get out of that situation so quickly, but I was an adult.
Mhm.
I mean, it's still bad, but I'm just saying like I had more agency
Right.
than a kid would have, but I think more people are coming out and there's more knowledge out there nowadays where people are willing to sign that petition too. Like,
Right.
maybe like 30 years ago, people would have maybe not, but now that more people talk about it, now that people like, um, Patrick Stewart talks about his mom's
Yeah.
DV situation and how he advocates for getting rid of statutes of limitations and
I don't believe like any crime against women or men in that kind of nature should never have a statute of limitations because some repress those memories for years.
and think
But
about
when they come,
too, like when people say, "Oh, it's not fair to Brock Turner that people are pasting his photograph on memes and reminding everyone that his name is Brock because he decided to go by a different name." I'm like, "Yeah, and he should be publicly reminded that he did that to that woman because she
yeah,
doesn't get to wake up every day and not be his survivor."
that's right, that's right, and those
I
are
think
very
that's
powerful
the
words.
core of the
Yeah.
issue that broke apart our community. We're not saying or talking bad about people. We're just saying that if you saw one of your friends beat up one of your other friends, would you just let the friend who beat up your friend go, or would you call the police and file a report and expect that the friend who beat up your other friend be held accountable? And I think that's the thing is accountability is messy and dirty, but it's needed,
It's
um,
so needed.
because that's the only way people feel they can heal at some point because you could go to therapy for the rest of your life, but like you said, if the person who did that to you is walking the street.
Hmm. And ended up doing it to my younger brother. I was not biological; I was adopted step biological son, and then stepdaughter. So there's three of us. But my brother, he he never told until like last year when he tried to pretty much unalive himself with alcohol poisoning. And he was in the Marines and had a beautiful wife and just a beautiful life, and no one had a clue. But I give all props to I still call her my mom, my stepmom, and she lives here right down the road from me. And I mean, I have my mother, but I still call her my mama, Kathy, because she raised me as my stepmom. She said the day that she said I looked him in the eye and made him point blank tell me the truth. And the day that he told me the truth, I filed for divorce. I have nothing but respect for her because she has nothing but guilt because she couldn't save her children. I said, you can't save something you don't know that's happening.
Exactly.
Yeah. And that's the
And
thing is, what happened in the cult, the people it happened to
yeah.
know it happened,
Yes.
and perpetrators know they were perpetrators. And
They
that's the
absolutely.
difference. It's different for, me to go to a friend of mine and be like, "You hurt me. I feel hurt by what you did, and I'm going to hold you accountable," versus me telling someone in confidence and then that friend going behind my back to the person who hurt me saying that I felt hurt. You know what I mean?
Yes.
And I think
Yes.
that's the point is we're all in this fight together, and I think the bigger this thing gets, the more fisher like, not everyone's gonna get along, and that's okay.
Yeah,
But
and
we can be
yes,
respectful, just
because
like
we're
with everything else.
look out here in this big world. We need to take a look at the big world. It's not doing so well on any factor. I mean, y'all, you have to understand. I live in Southeast Texas. The border issues, and I'm not talking politics. I'm saying even for my mental health, the border issue is a big deal. We have people that are just getting just so violated in crimes and murdered and killed, and it's like, is it ever going to stop? You know, here we go again. It's my light. Hang on. I don't know why it keeps doing this. I'm gonna have to figure that one out. But it is my light. Now I know it. It'll.
But
And my
yeah, I
light is
do
also
have to go
my
to bed
camera.
because I have to be up at 6, but this was
Okay.
really great. I think these check-ins are definitely needed.
Do y'all have 1 second? Let me get back on here. I wanted to. I won't be. It's coming back on right now. I don't know why my light keeps going off. I need to check the power thing on it. So,
And I was just gonna give y'all a little comic relief. My head is under attack, and she only does this when I'm streaming.
I've noticed that. Okay, so look,
I can be
Kate,
any other time of day. I can be sitting here. She doesn't normally bother me. I start streaming, she attacks my head.
He's
Shame
like,
is
"Calm
slowly
down.
eating me up.
You
That's
have a
my
cat
number one.
tiara."
What would y'all say to her?
The thing I've had to teach myself with about shame is, and it's a whole lot easier said than done, and I know that, but I've had to just keep reminding myself that being ashamed doesn't change it. Doesn't change what happened. Anything I've been ashamed of, it doesn't. I don't know. It's like I've had to retrain my brain.
There's only one uh difference between a shame and a sham. And I think most of the time that you're gaslit or made to feel that it was somehow your fault what happened to you, it's a lie. It's a sham.
I
Um,
like
and but it's the emotional impact is harder to heal from because I think for me, I was like, I watched a lot of videos about what domestic violence was. I thought I knew the signs to look for. So for a long time, I was just super hard on myself that I gave him my ex grace. I was like, you gave him so many chances. You should have seen the red flags. But then I stepped back and I thought, "Wait, that's not how it works."
It's not a
Like when
perfect
you love
world.
someone and
Mhm.
you really believe that that they'll change or that
And
they
that's a true
love you,
belief. I mean, that is
you
a
know.
true belief, you know?
But yeah, and the way
And
I
then
think about it is like let yourself feel any emotion that you feel is pointing something out. But at the
that's
end of the day, you have to figure out a lesson from that. Like my therapist said, okay, if you didn't meet your bad ex, what if you met somebody 10 years later and you might have been even older and you
mhm.
didn't have that experience to go off of, and now instead of it happening at 27, it happened when you were 37,
That's
you
so
know?
true. It's so
And
true.
when she put it in that perspective, I was like, "You know what? You're absolutely right." It taught me a lot of things. it taught me to be bluntly honest, because if I'm bluntly honest and somebody can't handle it, then that's not the person for me, friendship or otherwise. Because I mean, if I have to deal with my dark truth every day and somebody really wants to know me and they ask about it, but then they feel uncomfortable, then I'm like, you should. It's an uncomfortable topic.
And change doesn't happen until the current situation becomes too uncomfortable to remain the same.
Yeah.
And that's just here's one. And I've had them on hold. Is the only reason I asked if y'all would help me with these, because I appreciate y'all's patience in the chat. I really do. Like the stress. Have you guys ever heard of accelerated resolution therapy?
I haven't.
She says,
Yeah.
I did this with my therapist, and it works really well. You can tap with art as well. And she said it is accelerated. It's very similar to EMDR, just faster. I need to check on that because EMDR is taking so long, but I mean, it's getting results, but not the results I thought it was going to get. So I need thank you for that. She says, oh, wait a second. Sharon said it's
And
like hit.
sometimes I think something I've learned from therapy is sometimes not what you thought you needed.
Right, right.
So it kind of is, you get out what you put in. And as soon as I was bluntly honest with my therapist and my doctors, I felt like I got more out of therapy. But you never go in and just handle an issue because they go, oh wait, back up what you said there, let's touch on that. And then they open another can of worms. And then you're like, great, now these worms are out. I didn't even know these worms existed.
Yes, and that's what I said, if you're gonna start that, I would definitely be living with someone that so that you're not alone. That was the first thing my
Yeah.
therapist asked me when we started this process, that I had a support system and that I was not gonna be alone at home at night, all night, and just because she
Yeah.
can't physically be watching me. And she said she would never be able to live with herself if that happened, something happened to me, that but I put in 100% because I want 100% out. So absolutely. James, I see you. Hello. You missed the pool, and that's on my tanning pool. It's only because I fell asleep in it. But well, y'all, this has been great. I think it was
Yeah.
so needed. Like
It really
Yes.
was.
I
Well,
really,
y'all
really
apparently I
I
have a new
so
scar.
appreciated this so much. Like, especially getting to meet Heather and Chow. Well, I mean, I watch her stream, but it's different when you're actually
interacting like that.
interacting,
And yeah,
yeah,
that's what I said. I want,
relating.
Lee, if we're gonna do a mental health check-in, we're gonna do it. We're gonna come up here and
I can close
it's
my eyes and just imagine how soft your cat is and that they're like rubbing on my face.
Well,
I miss
hey,
her
actually,
but
sweetheart.
these
You got
cat
a
they
message. Are you okay?
not gonna lie
At least
that
tell me a yes or a no on this before I get off of here.
yeah, I'm better.
me.
I feel better.
I was gonna say I'm
And
okay.
and and Tampa Bay man, I want to make sure
Oh,
she's okay.
hey, Barbara.
Barbara, just tell me yes or no.
Indigo, it is so good to finally be able to put
I
a face
know.
with the name.
Oh yeah, you
I've
too.
been
I just
talking to you for
realized,
all these
yeah.
months.
Oh,
I know.
I'm glad you
I'm
were going
so
through some
glad
stuff,
because
Tampa.
we got like a whole 2 weeks planned with you, Indigo.
Oh yeah, to plan with
Yes,
Gretchen and everything, or to like
I
let me in
love
on the
it.
plan.
Like y'all really have got this down.
And
It's just
but
Yeah.
great.
actually, yeah,
I'm
as
just
far as
glad to hear
therapy,
Tampa B man's feeling better because I know that's been a rough go
I
there.
know.
So
Says I'm much, much better. Thanks. I have been so worried about you. You know I love you. Ooh,
that's the thing I try to explain. Like, my parents still don't really understand how you can like make authentic friendships online because they're
you
in their 80s. And the internet was not a thing for them, like it was for me. And I tell them, I'm like, there are people that I would if I met in person for the first time, it would be at my wedding because they helped me through like really hard things in my life. Um, and I'm so blessed to have stumbled into this community. Like I
So
know I say it all the time, but I never thought I would be in this protesting thing and meeting all these people, and like I think the universe put me where I needed to be.
I say that all the time. It doesn't put you where you want to be sometimes. It puts you where you need to be.
Yeah.
And I do believe that. Just like I didn't get my person that was supposed to come on today because this was needed. I mean, that's called
All right,
Well,
instant
guys.
instant karma, where you can actually see, things like that that you can actually see come to fruition.
and the
And
short of the long of reminders for everybody in the community, creators, viewers, if you need a break, take it. It doesn't
take it.
matter how long it is or how long you're not modding for someone. If you need a break, take the break. This stuff isn't going to be gone in 12 hours. If you take a 24-hour break, it'll be here when you get back. But if it's between you or this community, choose yourself
Yes,
every single time, because if you're not here, we'll notice it.
absolutely true. And I do trust me on this one. One of my friends knows that I notice when she is in here, and I'm the first one that says, where's she at?" I mean, I didn't understand how Reese could go and read all of these names, like thousands sometimes, like, and knows about every single person, you know,
Listen,
and
we're going to do a video that is only roll call. The whole purpose of the video is going to be roll call because, you know, we
yes,
do we do notice who's in the chat and who's not in the chat.
we do. And I do,
That's
especially, like, I'm like, okay, we haven't seen this person in a while.
right.
And I if I don't, or somebody texts me that I don't talk to, but I text with them and I don't hear from them for days, yeah, I'm getting worried.
I'm
I,
sorry.
I'm going to start trying to find them. But
I'm,
okay, well, since y'all two are the only ones left on here, I'm going to ask you two the same question I ask at every single one of these: is if there's anybody out there going through the same things that you are, or going through anything that that you're here fighting, what would you tell them?
I'm sorry, guys. Miracles messed up my earbud. Can y'all still hear
Oh,
me?
yes, I can hear
Okay,
you.
y'all are. For some reason, the sound is now coming through my phone instead of my earbud.
I can't even find mine, and I can't go to bed without them.
Can you repeat the question?
Yeah,
I got distracted by the cat.
I know, it's so cute. No,
You're
I just
Shelly.
ask. I ask every. Oh, thank you. Just as I am, I appreciate that. Um, love you, Sharon. Um, love you, Tampa. So I ask everybody the same question at the end, and I know this isn't a formal thing. We're just talking, but if there's anybody out there going through the same thing that you're going through, or anybody out there going through what you're fighting for, what would you tell them if they could hear you right now?
Um, that it's gonna get better. I mean, that's really the only thing I would know to tell anybody is that
It
the nothing is forever. This too shall pass.
This too shall
You know,
pass. I agree with that.
Two
and
things. Um, one is a two-word phrase, you matter.
Absolutely.
The second one is there you are not alone.
right, exactly.
You matter. You're not alone. And this too shall pass. I
And
think that's beautiful to end on. So, but I appreciate every single person that has been in here tonight. Y'all, you don't know what y'all done for me. I mean, this has been truly amazing. Like, I
Yeah.
was just in such I mean, even with the lack of sleep, I've been in such a mood of just, and I didn't even get on YouTube yesterday. Okay. I had to work. So I didn't even know what was all going on. So that's why I said it's not even about that. It's just about a mental health check-in because people are really having a rough time right now. And I want to say
Yeah.
thank you both. Thank everybody. Thank y'all.
Yeah.
I mean, I truly appreciate it.
Thanks,
I see you,
everyone.
James.
Thank you,
I see
Marie
you.
Ratsicott, for coming to the chat for the first time. Blake and Gretchen and
Yes.
Chow, Yadira, Tampa B Man. I say it in the chat all the time. Another message to end on. It doesn't matter what time you get in a chat or you hit up a live. It's when you needed to be there.
That's right. That's right.
Exactly.
And I needed this, so thank you all.
Yep.
I really appreciate it. And I'm gonna try to find my outro so I can do this like Kathy taught me, but I'm not really good at it yet. Okay, I think I found it. Okay.
I think
But
I
thank
try to
y'all.
find
And
my other
I would
earbud.
remember Liz Gale. Oh no, wait. I'm sorry. Okay, so I've been promoting Liz Gale. She will be on here Monday, 1 Pacific. I'm going to be interviewed by Gretchen tomorrow at 3 o'clock Central. So 1 o'clock
All right.
Pacific, 3 o'clock
Oh,
Central.
and hey, as far as I was just gonna let everybody know just to kind of I guess in the week on a funny note with this
Mhm.
supposedly OSA
Yeah,
list
you're
that's
OSA
been
Int, dang it. Look, y'all,
yeah.
I've got OSA Int front stage
Oh
in the
my God,
center.
isn't Cheryl and Mistiff Manage the same
I
person?
know.
And
Kathy
Chow and
Ann's
Dusty are the
OSA.
same person.
Dusty, oh my God, no, Dusty is Chow Yun Smut
Oh, wow, wait, I
and
have 1, 2, 3 people, 4 people?
SPTV Gaming Channel, which are both women. So Dusty's
Yes.
drag game is really good, guys. It's really
And
good.
No, she used to
I'm
be
a,
on here. She was on here
and,
last night or the other night with us, and on my personal page too. Yeah,
and
my personal
apparently
page.
I'm OSA and I live at
You're
the Hacienda Gardens.
but you're OSA Int. Now you gotta take that.
Oh yeah, OSA Int. I'm sorry.
You're OSA Int.
Oh man,
Anyway,
you're the top Osa.
I know.
Dusty
Damn.
Dusty is gonna do a panel on his channel tomorrow night at 10 o'clock Eastern
Okay.
time
Easter's will be
for
okay. It'll be
10 p.m.
9. It'll be
10
or
9.
p.m. Eastern.
a.m.
So of several of us that have been outed as being OSA.
Oh yeah, I told Yadira she was on the list. I was like,
I know.
what? No way.
You daring they spelled Kathy's name wrong.
This dumb list. Oh yeah,
You know,
they
they
were like
miss
Kathy Scoggins is Osa. I'm like, did you get her name right though?
No, Kathy Ann.
they
Kathy
had
Ann.
Kathy
What?
Ann and Kathy Scoggins. They also
Both of
misspelled
them.
my name.
Yeah. That's why I say Kathy Ann's OSA,
You
and
know, the funny
she's
thing
OSA
about
Int. It's just
The,
craziness
I'm sorry,
everywhere.
but
So
the funniest one to me was Feral Cheryl.
I
With all
know.
this stuff she's been accused of doing, I'm like, she's in front of the camera like all the time.
and they were like, wasn't oh no, I think they said that they thought didn't they say that you and her were the same person or she was the same person as Mischief
She was
Managed? I
just
can't remember.
mischief managed.
Yeah, I'm like, no, I've
Wow.
met both of them on camera. They're definitely got two different. Well, not Mischief Managed, but Cheryl's definitely got a British accent. That's all I
And
know.
When we were in
and
Austin for the protest in Austin, for Pearl Fest, I'm telling you, me and Liz and Alicia and Laura and everybody sat down and we look. That was the best time I've had in so long, just to sit with them and actually not just through video. I mean, actually sit down with them, and we had the greatest weekend ever. Just people coming and going, Lori and Farrell, Cheryl, and just everybody flying in and out at different times. We just had a great time.
I just, I just wanted to tell, that they're saying that what was it, Feral Cheryl she was stalking, I can't think of the name. She was stalking somebody in Texas and she
No,
was
not
doing all this other
Hellcat.
stuff. And I was like,
Hitzel.
Hitzel. Then they
Yeah,
said
so
that if anybody knows Cheryl's real name, to please let them know. I'm like, she's on Facebook. She's on my Facebook. I know her real name.
Yeah.
We were joking in post chat. I think it's
Her
post chat
first legal
last
name
night.
is definitely Farrell on her birth certificate. Like, come on, guys.
I know, right?
I just thought it was funny. We were joking in post. I think it's post chat last night. We were joking. We are like, "How much you gonna pay for Cheryl's real name?"
Or like we were joking. I'm like, sorry guys, my legal name isn't actually Indigo Twin.
I know.
You guys tricked me.
And sorry, my name's not Sunrise Dawn.
No, but you know what? I'm so
No,
wait.
it's Moonrise Darkness.
What was
Secret alias.
what is it? Wait, what somebody say? Don't call myself stupid. Call myself what?
Silly.
Silly. Yeah.
You're
Okay.
being silly.
I
But we're
really
doing a
should have.
Midwestern goodbye, so I have to go because I have to be up for
Yeah.
work tomorrow.
Yeah. And I shouldn't have used my real name starting this out, but I did. So now it's out. And, oh well. So is what it is. But thank y'all, love y'all, and I really appreciate y'all. Thank you so much. And I
You
am
too.
going
Good
to
night.
do this right.
Good
Bye,
night.
y'all.
Bye.
Okay,
Ow,
I'll-
Miracle. I'm sorry, she's attacking me again.